Good morning to everyone. Thank you very much for coming. My name is Ana Barrera. I am Director of Programs in the EU-LAC Foundation. I extend my warm words of welcome both to the people that are attending here in person, our symposium, as well as those who are attending the Zoom platform. It will be a one-day event, and there will be many people who will connect later on, and also who will join us here in the Charité later on. We will start with small introductory and welcoming remarks from the representatives of our institutions and also the representatives of some of our member states. And then the symposium is structured in 3 thematic panels, and it will conclude with a public roundtable. Every session will be moderated by one of the representatives of our institutions, the GLACIER project and the EU-LAC Foundation. The first panel will focus on the heterogeneity of responses to the COVID-19 pandemic in Latin America and the Caribbean and in Europe. The second panel will focus on the issue of cooperation and coordination and networks, which during the time of the pandemic, we saw diminishing among world regions, but also among different neighboring countries. And the third panel, we will discuss also the important issue of financial resources and funding, both private and public, to facilitate the provision of health services as a public good and to strengthen the work of research, consortia, collaborative initiatives, alliances and networks. And then in the final roundtable, we will do a wrap up a little bit with different experts who are accompanying us throughout the day. And we will ask their participants to outline their visions on how they see how we could move forward to address the shared health challenges in a spirit of shared responsibilities. Of course, we will also have breaks, and we invite you to really to take the opportunity and to strengthen our networks or build new contacts among the participants and the audience here. We will have a final reception also in this day. And as a follow-up, we will produce, together with our partners, a policy brief, resuming a little bit all the important shared arguments and the findings here. And we will disseminate it, of course, among all the participants and also among the interested public audience in Europe, Latin America, and the Caribbean. Please take note that this symposium will be held in 2 languages, in English and in Spanish. In case somebody requires translation services, we have with us skilled interpreters in the Zoom platform. So people who join us in the Zoom platform, they can listen to the translation going to the bottom at the lower bar of their screen and switch to the language that they want to listen to. And also to those who are here in the auditorium, you can connect to the platform and use your own audio phones in case you need it. So without further ado, I would like to invite Felix Drexler to inaugurate our symposium.
Thank you, Anna, for the perfect introduction. Thanks, everybody, for joining today for this high-level event. We are very proud to have you here online and in person. I am giving these opening words in 2 functions. One as a researcher of the institution hosting this event today, physically, the Charité, my alma mater, but also as a co-coordinator of the GLACIER project, which is a project that not only co-hosts and co-organizes this symposium, but that also has been acting on global health and One Health with Latin American partners for the last almost 4 years. And it's a project that unites scientists from Latin America and from Germany, from several Latin American countries. It's always one thing to get scientists to cooperate. Usually scientists, we get along pretty well if we want to cooperate. You have ups and downs in the life of a scientist, but usually you have a common goal, which is produce good science. So usually it's not too hard to get people who are really burning for a science, for a global health topic, to talk to each other, to make a project, to maybe write a paper. So this is all something we are used to. It's our common business. It's a completely different piece of cake to get stakeholders to be engaged. And that is not easy. This is not our normal world. We normally don't talk to, most of us, researchers, scientists, professors, we usually don't talk to decision makers easily. Sometimes we do. In the pandemic, it did change, and we talked to people who were actually making decisions that affected the politics of entire countries, to ministers, to presidents, to vice presidents. This is not the normal kind of communications that we engage in. And the pandemic has been declared over, and so has in part our interest, how interesting we are for politicians, has also decreased. There's always many things going on. Health at the moment, in a times of global crisis, is not seen by our government, speaking in the case of Germany, as the most pressing issue. For actors of global health and even global health, this is a very unfortunate situation, because we are left with the question, what have we as a community learned from the pandemic? And when I say community, I don't mean just the scientific community, and it does include the stakeholders. This is not easy. Stakeholders have mandates. They are usually elected for a short period. They change, they have agendas. They want to be re-elected, or they want to have a good setting for their party. So their decisions are not necessarily driven by sustainable, lesson-based, evidence-based, say, data. And there is a disconnect between the scientific community and the decision makers. This symposium addresses this gap and tries to align decision makers with people working on the ground in the area of health at very different levels. And this is why I think I'm very grateful to all the people who have contributed to make this happen. And this includes many of the people in the room. You will see several of them as speakers. I will announce them. I will not announce all of them. Many of them have been companions during the course of the pandemic, and we are here and trying to leverage our experience into a global health agenda in the European Latin American nexus. And this is very special. It is this opportunity that makes this synergy between GLACIER as a more scientific project and the EU-LAC Foundation as a stakeholder-oriented, policy-oriented organization, together with the GIGA, the German Institute for Global and Area Studies, also more politically oriented, funded by the German Ministry of Foreign Affairs, or at least co-funded, together with the state of Hamburg, of course. So we have 3 actors here. And this is a perfect scenario because it does enable outreach. And I'm very grateful to GIGA and to EU-LAC Foundation, to Anna, to my team, to Bert's team, for being here with us, for making this event possible, and for your attention. And before I hand over to Adrián from the EU-LAC Foundation to continue the opening words, I would like to briefly announce that in the program that you have all received, you will see that there is still the name of Martin Bergfelder as one of the opening words, or one of the persons giving opening words. We were lucky, so he's not here, and that is good, because we were able to softly convince him to, instead of just giving opening words, to be a panelist. Martin Bergfelder is one of the persons who have negotiated the pandemic, say, agreement, which is under hot fire because it's not easy. You may have seen that WHO has been trying to get this mandated, to get this, and it's not easy because it touches many of the things we maybe discussed today, patents and patent protection, intellectual property protection, one of the most difficult issues to resolve. So this is themes that will be coming back during the day, probably. And we're very lucky to have him as a panelist. So I'm looking very much forward to him, but this is why he will not give opening words, because we will see him later as an active combatant during the roundtable, which we will have at the end of the day. Finally, and I know I'm talking too long, we are aware it's a long day. Bear with us. I'm sure it will be worth it. And we deliberately decided to have this all in one day, even if it can be long, but instead of having a 2-day symposium, which may be also difficult to organize for many of our participants, we have it in one long day. I'm sure it's worth the effort. And with that, I hand over to Adrián, the president of the EU-LAC Foundation. Thank you.
Muchas gracias, Félix. Queridas amigas, queridos amigos, efectivamente va a ser un largo día, pero porque estamos muy cerca del solsticio y los días son largos. De manera que lo vamos a aprovechar del mejor modo posible. Quisiera, a nombre de la Fundación EU-LAC, dar la bienvenida a todas las personas que nos van a acompañar en el simposio del día de hoy, cuya temática es tratar de construir, ¿no?, las ideas centrales de lo que podría ser identificar los desafíos y las responsabilidades compartidas a propósito de los temas de salud global, particularmente en la interacción entre las regiones de Europa, América Latina y el Caribe, ¿no? Es muy grato poder implementar esta reunión en colaboración con el Instituto de Virología de la Charité, que es una entidad legendaria y centenaria, y también con los otros socios que nos están acompañando, en concreto GIGA, y quiero agradecer a Bert por la colaboración que hemos tenido, a la AIS Global, sobre todo a la oficina de Barcelona, ¿no?, que además fue el recinto de trabajo de nuestra presidenta. La Fundación EU-LAC funciona con una dirección ejecutiva que la ostento yo por pocos días más, y una presidencia que corresponde a la otra región, América Latina, la presidencia Europa, en donde está Leire Pajín, quien va a estar en la última mesa redonda, que acaba de ser elegida además europarlamentaria, ¿sí? Hace un par de semanas. También pues a GLACIER, que nos está acompañando, que es un instituto extremadamente importante. La idea es que expertas y expertos de las dos regiones produzcan algún tipo de reflexión que nos permita sistematizar de manera que podamos comunicarnos con las instancias y con las personas que toman decisiones en salud pública en las dos regiones, ¿no? Si estamos hablando de un tema internacional, es indispensable que haya coordinación, por supuesto, entre las comunidades científicas, pero es igualmente importante que haya coordinación y que haya información compartida, la misma información que viene de las deliberaciones y de las reflexiones científicas para las personas que toman decisiones, porque de lo contrario no es posible producir políticas públicas eficientes, sobre todo si se trata de temas que atraviesan fronteras, como fue el que sufrimos con la pandemia del COVID-19. Y justamente esa experiencia es una de aquellas que va a guiar las reflexiones durante el día de hoy. Y la experiencia del COVID-19, además de los impactos dramáticos que tuvo en los escenarios de salud, pues generó en el caso de América Latina también otro tipo de impactos en la economía, en la política, en la institucionalidad, ¿no? En el caso de América Latina, hablando de esa perspectiva y del Caribe, estamos identificando a la región más golpeada en el mundo por la pandemia del COVID-19. No solamente por los índices de mortalidad que fueron extraordinariamente elevados, sino por lo que esto significó en la estructuración de sus sociedades y en la reproducción de las economías de las personas. En concreto, lo que nosotros tuvimos en América Latina y el Caribe con la pandemia del COVID-19 fue una degradación de todos los servicios públicos, ¿no? Un aumento importante de la pobreza extrema y de la pobreza en todos nuestros países y una recuperación de los índices antiguos de inequidad, ¿no? Que en el caso de esta región ya eran bastante malos, los más malos del mundo en realidad antes de la pandemia. En la primera década, pues de este siglo, estos índices empezaron a revertirse y esto se acabó con la crisis económica y la pandemia que la sucedió. Por ello es que planteamos como sugerencia abordar las discusiones desde varias preguntas de carácter general que puedan ser asequibles no solamente a las personas, a las personas, a los científicos y a los técnicos y técnicas que van a trabajar el día de hoy, sino a las personas que toman decisiones, ¿no? Preguntas que tienen que ver con saber si es que los sistemas de salud pública de la Unión Europea y de América Latina y el Caribe están ahora, después de la experiencia que hemos tenido, mejor preparados para responder a brotes epidémicos o pandémicos. Tratar de identificar, además, este es otro de los propósitos y de las preguntas, cuáles son las principales lecciones aprendidas con la pandemia del COVID-19 en términos, por ejemplo, de la producción y distribución nacional e internacional de vacunas. Acordémonos nosotros que fue uno de los elementos centrales de la discusión de las jefas y los jefes de Estado y de las preocupaciones latinoamericanas y del Caribe, porque las vacunas para esa región, al menos las producidas en Occidente, en los Estados Unidos y en Europa, llegaron con más de un año de retraso, ¿no? Eran las vacunas más eficientes según el sentido común médico de ese entonces, llegaron otras antes, y esto es algo que, bueno, debería permitirnos pensar, ¿no? Porque alrededor de los temas, y estos fueron los temas planteados por los jefes y jefas de Estado de América Latina y el Caribe en la cumbre que tuvimos de ellos en Bruselas del año pasado, se introdujeron los temas de salud público, más allá de los temas de desarrollo, de crédito, y de estabilidad política que han sido tradiciones en esas cumbres, ¿no? Eh, Quisiéramos también, o propondríamos, o sugeriríamos que conversemos sobre cómo establecer estructuras que nos permitan hacer frente mejor a los desafíos sanitarios de las dos regiones y también identificar si se pudiera en el plano concreto del tema de este simposio, donde hay sinergias, donde se podrían identificar sinergias y oportunidades de coordinación entre las dos regiones, lo que nos llevaría pues a tratar también de identificar pistas que nos permitan producir señales sobre políticas públicas conjuntas. Yo creo que va a ser una discusión muy, muy interesante. Agradezco a todas las personas que nos están acompañando en este simposio y a las entidades que se asociaron para poder producirlo. Muchas gracias.
Muchas gracias, Adrián. We have now as another speaker invited Miriam Brevka. She's connected to the Zoom platform. She's senior expert on global health in the European External Action Service. And Miriam, The floor is yours.
Buenos dias, guten Morgen nach Berlin. Good morning from Brussels. I hope you can hear me well.
Perfectly.
Thank you for welcoming me to this important event, also in a virtual manner. I regret that I cannot be there with you in Berlin. I'm delighted this morning to represent the European institutions and to say a few words on behalf of the European External Action Service. The European External Action Service is the EU equivalent of the Foreign Ministry. And I work there as a senior expert on global health, heading a small team on the issue. As you're well aware, the COVID pandemic had a very significant impact on all our societies, and as such has also entered the world of diplomats and decision makers, as was mentioned by the previous speakers. So today's symposium is particularly important in bringing together both the decision makers and the political aspects and frameworks that we work on with the work of the practitioners, the experts, the scientists. It was also mentioned that it is important to keep up the political momentum, reminding us of the importance and the need to work on global health issues and address the vulnerabilities and the challenges that we have been faced with on both sides. Against this backdrop, let me just say a few words about the EU's global health strategy. The EU Global Health Strategy is the equivalent of the EU's internal health union, and it positions global health as an essential pillar of work in the area of the EU's external policy and relationships with partner countries around the world. This strategy was adopted in November 2022. We have seen Council conclusions from the EU member states beginning of this year supporting the strategy as such. The strategy promotes sustainable and meaningful partnerships at bilateral, regional, and multilateral level, drawing also on the framework and building on the EU's Global Gateway Initiative. We have three priorities under the strategy. The first is to deliver better health of people across the life course, but also across the globe worldwide. Secondly, it aims to strengthen health systems and advance universal health coverage. And thirdly, it aims at preventing and combating health threats, including pandemics. And of course, we have already the first panel discussing the lessons learned, and the strategy indeed is a way of trying to bring the lessons learned into political decisions. In this context, you know that we have engaged in a significant EU partnership with the countries, with the community of the Latin American and Caribbean states, the GLACIER, with the aim of reinforcing cooperation in several key areas, manufacturing vaccines, medicine and health technologies, and strengthening health partnerships. As a very concrete illustration of this partnership in Brussels, we saw in March of this year a very important high-level event which brought together decision makers and practitioners from both regions to discuss and move forward on the EU-LAC roadmap that we have set for us on global health. It was an important event as is discussed and brought about enabling frameworks on equitable access to health products. And it was meant to advance discussions on potential partnerships supporting the EU-LAC Global Gateway Investment Agenda. Secondly, it also took a much broader approach, embedding the discussions on global health also on the issues of social policies and highlighting by regional challenges in this specific, much broader framework of social systems and social inclusion. And finally, it allowed us to work towards a regional Team Europe initiative on inclusive and equitable societies in LAC as an important part, an important step forward towards the next EU-LAC summit that we will see in 2025. Beyond this specific work, you may also know that the EU is involved in supporting PAHO, the regional organization, and working on a specific project to foster access to healthcare technologies. So as such, we are working towards keeping the political momentum and the global health high on the EU's agenda. We remain committed to the strands of work that you will be discussing today, to the future conclusion also of an important pandemic agreement that should strengthen the international community's capacity to address pandemics and health challenges. And I wish us insightful and fruitful debates on the important topics that you have outlined in the different panels for the event today. Thank you again, and good luck to us all.
Thank you. Thank you very much, Miriam. We also have a last person planned to be with us. He's the ambassador of Honduras here in Berlin, but we are hearing that he has difficulties to find exactly the auditorium, but there he is. So I hope he's ready to directly jump into our introduction session. Buenos días, embajador. Usted viene en un punto perfecto, si es que puede, le paso la palabra. Gracias por haber encontrado el auditorio en el laberinto de la Charité.
Muchas gracias. Hola, muy buenos días. Disculpen la tardanza que nos perdimos. Es demasiado grande acá. Bueno, muchas gracias. Gracias al director, a EU-LAC, por la invitación. Muy bonito evento. Espero que sea de mucha ayuda para ustedes, para nosotros, la enseñanza que vamos a tener aquí, la instrucción, y bueno, a disfrutar. Y muchas gracias de nuevo. Permiso. Gracias.
So my role will be to moderate the first panel. We have been thinking to design those dialogues among the experts here as interactive and dynamic as we can, because all of you who are gathering here really have a lot of knowledge and expertise. So we want you to offer really the space to exchange. We will invite you in the first round to the panelists invited to hold presentations or interventions of about 10-12 minutes. And we as moderators will be relatively strict with our time. This is not for being strict. This is just to allow for a discussion among all the people here who are sitting in the audience and also those who are following us in the Zoom platform. As I mentioned before, the first panel will be dealing with the heterogeneity of responses in Latin America, the Caribbean, and Europe to the pandemic. It was at a relatively early stage still of the pandemic in March 2021 when the EU-LAC Foundation organized a digital two-day event in order to talk about what was the most pressing issue of that moment. After having overcome the challenge of developing an efficient and safe vaccines for or against the coronavirus in record time, the most pressing challenge from the view of our members was the asymmetry between the demand and the supply of COVID-19 vaccines. The vast majority of the doses of vaccine have been produced and distributed in the most developed regions and countries, including the United States, the European Union, United Kingdom, Canada, and Japan. And the slowness of this uneven deployment of vaccines was largely due, for example, to limited global vaccine production, but also insufficient funding and coordination of distribution, which put into question the very idea of global governance facing a crisis of this scale. Many Latin American and Caribbean states lacked the scientific and industrial capacities and relied heavily on the import of vaccines and other medical supplies. In addition, we also witnessed reduced capacities in terms of logistics, distribution, and coverage of health systems. On its part, the European Union, in parallel to addressing the pandemic in our region, has also advocated for a multilateral approach that aimed at ensuring universal access to vaccines. European member states and the European Commission were major contributors to COVAX, the COVID-19 Global Access to Vaccines Facility for equitable and affordable distribution to low and middle-income countries. And there was, as you might remember, criticism of the rise of health nationalism and vaccine geopolitics. And there was also a prevailing awareness of an unprecedented global interdependence. The later the vaccine reaches the geographically remote parts of the world, the greater the likelihood of the emergence of new variants of the virus that were potentially more immune to the vaccines that have been developed so far. All of this sounds very far remote, but actually these were the pressing issues that have been also dealt with now when all the members of the World Health Organization were trying to find an agreement just several weeks ago. And in order to achieve a rapid distribution of vaccines to the world's population, and having set a focus on the most vulnerable groups and also the health personnel, it was already clear by that time that the current instruments for a regional, bi-regional, and global coordination and cooperation required to be strengthened, to be more innovative, to be more adaptive, and also to be more solidaric. This included, for example, sensitive issues such as technology transfer and the management of intellectual property and production licenses. And everyone was also talking about not missing the opportunity to opt for a better reconstruction geared towards economic, social, and environmental sustainability, including a determined commitment to investments in science, research, technology, the development of logistical capacities, and regional value chains. So now we are 3 years later from this exchange that we organized by that time, and we want to take a fresh look at the cooperation between our regions, and we want to ask, what have we learned actually from the COVID-19 pandemic? What are the implications of those lessons learned if we look towards our cooperation today and of the cooperation in the near future? What needs to be changed to ensure a more equitable and more efficient response to such health crises? And as we saw that policies also varied widely within the regions and within countries, from vaccinations as to non-pharmaceutical interventions, testing policies, diagnosis, and treatment, what best practices, lessons can we draw from these different approaches? In this sense, I open the floor now to our first speaker, Felix Drexler.
Thank you very much, Anna. I sent my slides yesterday to Laura. I'm not sure if that was understood. Are those transferred, Laura? No? Good. Then can you connect my laptop? Just need you to bear with me because my computer is terribly slow in starting. Sorry, the hand drive is not recognized. But now we have it also here.
Hast du die?
Genau, super. Super, Dankeschön. Und ja, kannst du die Slides oder alles funktioniert? Super, Dankeschön. Thank you very much, and sorry for this hiccup. I will let me see if the pointer works. Not really. Okay, no worries. If it should be self-explanatory. So this is the first talk of the first panel, and it's a scientist's talk. So it's probably one of the talks where most talking about data of today's symposium. It's of course about the COVID-19 pandemic and what we have learned and not learned. It's not working. Can you switch manually? Next slide. Thank you. For us, I am not a very typical virologist. Virologists are normally cell biologists. They study a given protein in a given cell with a given virus. A virus infects a cell. How does that pathogen interact with immune responses? This is most virologists do that kind of work. And I'm not doing that. Instead, I work with diagnostics and evolution of new viruses, and I do so with a particular focus on Latin America. And the COVID-19 pandemic proved that topic worthy of investigation. And you see those books were written over the past 20 years, and they all have a common topic. What's the doomsday virus that will exterminate mankind? What's the next pandemic? What is the coming plagues? And that's, so this is, of course, is they are books for the lay public. They are not for scientists, but they all address this exactly the scenario that did happen when the pandemic started. Next slide. This is a modeling paper that was published 2 years ago in Nature, and it tries to model climate change, pathogens, biodiversity, and many aspects in predicting where the next pandemic may emerge. And the answer is very clear: in the global south, including, not limited to, but including Latin America. This is the world map. Is wherever you see more intense yellow color is a projected hotspot of emerging pathogens. And you see that big parts of Mesoamerica, of Northern Southern America, the Amazon basin of Brazil, large parts of Africa and large parts of Southeast Asia are very colored, this is because they have all the elements to give rise to a new pandemic. Next slide. At the same time, exactly the same box shows you that those are the most resource-limited regions. So they're actually the countries worst. They are the countries most likely to start the new pandemic, and they are the countries worst prepared in that case, which is for a whole plethora of factors that we will be discussing today, but it's a worrying start point, I think. Next slide. And at the same time, and equally worrying, is the fact that global cooperation is not equitable. Many of the countries in the global south are entirely underrepresented in international cooperation. This graphic shows collaboration in 22 to 23, and it was, I think, in a Nature index. And you see that some countries collaborate a lot. The US, Germany, the UK, France, many European countries are here. Of the global south, we also have some countries in the middle below the US. You see Mexico. So it's not like the Latin American scenario is completely out of collaboration. But if you go to the edges of the graphic, you have many African and Middle American and poorer South American countries that are not represented a lot in international collaboration. And when I say international collaboration, I of course don't mean only north-south, south-north. So this does not mean only that, okay, Brazil should collaborate more with me. My Brazilian friends are in the room, and you will see you will hear a talk from the Vice President of Fiocruz in a second. That's not the point. We are also weak in South-South collaborations, much weaker than we should be. Brazil is not sufficiently collaborating with Peru, Ecuador, Colombia, and so on and so on. These are neighboring countries in South America. The same applies to Middle America, and of course, the same also applies to Europe. I'm not trying to frame this, just to be very clear here, I'm not trying to frame this as a uniquely South American or Latin American problem. We have the same issue in Europe, to different extents, of course. There is a strong need to be better, because we cannot just increase our budgets for pandemic preparedness. The pandemic agreement will be under debate today. It's not an easy task. We cannot just bake money. We cannot find diamonds and gold that would just enable us to do everything we want. One of the solutions is to discuss what is the most efficient manner to be prepared and to strengthen healthcare. And the other issue is collaboration, in my opinion. And it's not, we are again not at a very good starting point. Next slide, please. It has been said by Anna and by Adrián. Latin America, it's not out of focus to discuss global health in the context of the COVID pandemic, in the context of this symposium. Latin America was particularly hard hit by the pandemic. This graph shows you the number of deaths from COVID-19 per 1 million inhabitants. Boxed on the bottom, the pointer is really not working. I cannot highlight it, but you see there's one red bar in like the lower third. That is the world average. On top, we have Peru, and it's the number of deaths until the end of 2021. Peru and Ecuador, two countries, at least one of the countries will be represented today in this panel by a talk from Juan Carlos Ceballos, who was Minister of Health during the pandemic of Ecuador, and who will be talking about exactly this scenario. So this is really an appropriate starting point for today's, for the lessons learned block, because we need to learn from this. We need to understand what was actually happening. Next slide. And this slide shows you something that we work on in my laboratory, which is, as one of the things we work on, testing for a new pathogen. This is testing for COVID-19, for SARS coronavirus 2. So it means do PCR or antigen-based tests. And what you see here is 6 world regions over time in the left side of the slide. And it shows you that some regions like Europe and North America have been able to increase PCR testing. It's mostly PCR testing for the new coronavirus during the 2 years of the pandemic. So the curve went up. It means that, okay, there's a new pathogen, we have to develop tests. We did develop tests, they are widely applied. So the number of people we could test, for example, to inform isolation strategies, to interrupt outbreaks, to interrupt transmission chains. So the more affluent setting were able to increase their testing, which is what you would expect as a response to the pandemic. Latin America, Asia, and Africa are the 3 almost flat lines to the bottom of the graph. So it's not, and that has an implication. It means that not only, if you go for many of you are Latin Americans, not only were your countries not in a good, say, starting point to widely offer testing for potentially infected citizens, you were also hardly able to increase that during the pandemic. And of course, this is an averaged curve. So we are mixing very heterogeneous settings. Brazil is not the same setting as we have the ambassador of Honduras here. Honduras is probably much more resource limited than Brazil. And then within Brazil, which is 2/3 of the South American continent, you have huge heterogeneity between Rio de Janeiro and Sao Paulo and the interior of what is a huge country. So of course, we are generalizing here. it's still a valid point to make. And again, that's a worrying scenario. Next slide. And you can have an easy reply for this. And I've started this. I've talked about being rich or an affluent setting or resource limited setting. This is the world map, inflated or deflated by gross domestic product. So it's like rescaled by how affluent the setting is. And of course, Latin America and South America gets thinner than it actually is. Not as much as Africa and parts of Asia, but it does get pretty thin, doesn't it? So yes, the resource limited, the global South has limited resources. I think this is it's a valid argument to say, well, of course, if you don't have money to buy expensive PCR tests, then you won't do them. That's an easy answer, and it's not a wrong answer. And I would like to question with you if it's the only answer. Next slide. And we are looking at this at the moment, and together with Andres Morera Soto, who is a member of my team, we have been looking at this for the last 3 years. It's for us, a very painful exercise because we went to social sciences, which is not our normal field of play. We've grouped the world, or we've taken world data on COVID testing. This is classified, summarized countries according to global burden of disease regions. So that's the colors on that world map represent a region. So this is the African countries for which we had data. Not all countries had enough data. Still belong to a global burden of disease region, which is, I think, a concept from the Lancet. So it tries to get homogeneous world regions that share properties. South America, Europe, and so on. And then within those regions, we looked at socioeconomic effect modifiers, potential effect modifiers of testing for the new coronavirus. Next slide. And what you see here is testing over the years, comparing 2020 to 2021, and within Central Europe and other regions. And you can see that the two bars are not overlapping. So there were changes in the way that regions and countries tested. First, they tested the 2020, the pandemic was new. Everybody wanted to get a PCR or an antigen test when they arrived in early 21. So everybody took a test. And that changed in 21, which is the yellow bar. So look at Central Europe, for example. After all, it's not just Latin America and this symposium, it's Europe as well. Central Europe tested more in 2020 on average, on median, the square is the median. So it's like the middle of a distribution, sort of. And they tested less in 21, which reflects probably both government stakeholder decisions, but also the willingness of people to take a test in 2021 for the 4th, 5th, and 6th time. So they tested less. And then, of course, it applies to all other regions. Next slide. And again, another effect modifier beyond just being affluent, having money in a system, in a country, is the investment in health. So this variable is here. The world is scaled by the variable is commonly termed current health expenditure. So again, it's not the same to have money as to invest it in health. We have a Cuban speaker today, and he will confirm this. Cuba is not a rich country, but Cuba invests a lot of its gross domestic product into health traditionally. So it's not the same. And current health expenditure is clearly linked in our analysis. And I'm not showing you a lot more graphs because I don't want to bore you with data and their analysis. But this is something you have to consider when you think about how our countries deal with health issues. Next slide. And then you have some surprising variables that showed up, which we were not expecting. For example, on the left plot, you see that in the Middle East, gender inequality, which is the variable highlighted with a blue arrow, so how equitable is health access between males and females, played a role. Females were less likely to take a test than males. And of course, there may be explanations for this in the extent to which females are able to work in some societies that are traditionally more patriarchic in structure, and it may hint at that tests were taken in a work environment to which women maybe participated to a lesser extent than males. We also have other, in the same line of like work environment, we have vulnerable employment as a factor popping up, which is the graph to the right. And it may hint at the same thing. If countries organize testing in a work environment, and I imagine it could be the case because you call your personnel to go to, say, a factory, and you say only people with a negative test are allowed to enter because I don't want to interrupt the production chain. I cannot have an outbreak. Imagine you are an important business and you say, and your government says, you are not allowed to stop. You should not stop. Only people with a negative test can go to work. And that happened. And then, of course, those people were taking tests. And people who are working on a day job in an informal labor situation don't have any of this. Next slide. And we talk about pandemic preparedness, and this is a big circle. It has many, many different things. So it has animal health, human health, and environmental health. It has climate change. There's so many variables we need to address. It's not an easy task. This is why we're here today. The GLACIER project, here you see our new logo. We are redesigning our logo. So you get 2 logos for the price of one. And within GLACIER, we try to address prevention, detection, response. All of this is not easy, and all of this is terribly complex. But it still needs to be done. Next slide. And there's a famous phrase, and this is my last slide before I get to the acknowledgement. There's a famous phrase during the pandemic, I think, I'm not sure if it was Tony Fauci who said it. Nobody is safe until everybody is. And in that setting, how do we enable this? We have so many issues in global health and in pathogens. We have a brain drain. Ecuador lost many of its physicians not during the pandemic, before the pandemic, because they simply could earn more money in Spain and beyond, I know. And they left. So you don't have a lot, so many of, this is a problem. And the same applies to laboratory. We lose people that go, understandably. That's not at all an accusation. If you can have a better life for you and your family, why would you not take the chance? Complicated issue, I know. We have what Anna mentioned. We concentrated vaccines in 10 countries on the planet, which produced the vaccines. The same applies to diagnostic tests. People in Latin America were not able to buy reagents that were produced for lab testing in Germany and the Netherlands. And the lab people here know what I'm talking about. It was just not available on the market. And I'm not even discussing that the price in Latin America is twice that I pay in Germany. So even if you accept to pay double in Latin America, you didn't have it. It was not available to your research institutes, to your public health institute. It was just, and that was a year before that we discussed vaccine concentration. And nobody's discussing this except the lab nerds, because we know. We have the breakdown of supply chains. Even if it had been available to your markets, the companies were stopped flying and transporting. It was not available. And then finally, we had travel restrictions. Somebody else decided who could travel where. And the most infamous example, maybe, likely, is when the Omicron variant of COVID-19, of SARS-CoV-2, emerged in southern Africa. Actually, it was detected first in November 2021 in South Africa and in Botswana, the first cases. It took the EU, the UK, and the United States 4 weeks to close travel to 9 countries in Southern Africa, including those 2 I mentioned, but also Mozambique, Botswana, Zambia. So that's a huge area. And this decision was taken without scientific evidence by stakeholders, understandably to protect exportation of the virus. It totally failed to limit the spread. But still, this is a problem because we as a region lose credibility and we want partnership. And if we do those things, this is really just me talking, my personal opinion. If we behave like this, it will be hard for us to be seen as honest partners by many countries in the global south. which is why we're doing that symposium today, because and this is my final sentence, we need cooperation. I've said that before. The cooperation cannot be just between scientists. We are used to this. We collaborate all of the time, most of us. We need this on a country and even more so on a regional level. We need, I'm not saying we have to have a Latin American CDC. We will discuss it later today. It's on the agenda. But even neighboring countries are not collaborating as much as we should. And with that, just to show the final slide, I'm not reading it. There's this, my research shows you the funders of my research on top. The DAAD with the global centers is to be highlighted here. It's the one in the blue bar. This is really the GLACIER project lives from money from the German Federal Ministry for Foreign Affairs via the German Academic Exchange Service, the Deutsche Akademische Auslandsdienst, and we are very grateful for this. This is the only fund I'm going to highlight, and I have to thank all my team, which is here on the right, and Andres Moreira for preparing the slide deck. Thank you.
Thank you very much, Felix. I think you prepared the ground for the discussions that we will be having. I would now simply pass on the microphone to Maria de Lourdes Aguiar Oliveira, with whom we jump to the other region. She's the Vice President for Research and Biological Collections of the Fundação Oswaldo Cruz, Fiocruz, in Brazil.
So firstly, good morning, and I would like to thank very much for the invitation to share our good and our very bad experience along COVID pandemics. Next, please. Yeah. I think along all these meetings, we will repeat the good and the very bad experiences we have, not only in South America, because of course we were extremely affected, but all over the planet. The fact is, we were not prepared nowhere of something of the COVID-19 magnitude. We had lived other pandemics before. I would recall influenza to the age 1N1 in 2009, then arboviruses and so on, but nothing compared to that. And so it's extremely important to really look behind and which were the mistakes and where are we really going to go and how to cooperate. And so Brazil was extremely affected, as Felix had already shown. The cumulative cases about almost 40 million, and the cumulative deaths 700. And some studies had shown that at least 400,000 lives would have been saved if we were responding in a different way. And so we had, I would say, the second higher mortality after US, even because in absolute numbers, even because of the population we do have. And so we cannot say that it was a successful response. And I would also have to comment that we'll see in the last slides that the political commitment is extremely important to really support. You can have all the scientific healthcare structure, but if you don't have a political decision to really follow scientific and the stakeholders take data-based evidences to guide their actions, to orient their actions, we will have again and again this kind of result. And so a long time, of course, we will have war increasing in 2020. I remind when we were looking the first cases in China, I was speaking with a colleague yesterday, hey, it's not an influenza. Oh, we would never suspect, and as a virologist, it was like spitting in my face, because we would never suspect that something like that, of that magnitude, could even happen from a coronavirus, for example. And we saw the real picture when the virus arrived in Europe. And so as we'll see afterwards, we started preparing how to respond to that. And so a long time, of course, it was the same movement and then the global epidemiology. A long time were decreasing the cases, especially after the boom of Omicron introduction in Brazil. And so although Brazil represents 2.7% of the global population, our mortality was about 10%. So it's almost a scandal. Then we have the epidemiological curves with main measures, because this was the homework we had to prepare. And so in 2020, yes, since the early beginning, we were adopting as global measures, the non-pharmacological measures. But in Brazil, it was very hard because we are a federal republic. And so every state has their own political decisions. We didn't have a real robust or standardized response in terms of adoption of quarantine, isolation. So it was a mess in the country, and it becomes very difficult for us to have a robust analysis about the effects of this kind of policies in the country as all. Maybe in some states, but it was not sustainable. Only at the very early beginning, then we could hold a little bit, but very fast because of economical troubles and challenges, we were opening, and then the big mess, I would say, had really started. And so very soon, we were abandoned the quarantine, and we were only thinking about lockdown in some cities, and depending on the ICU occupation, the ICU beds occupation, when it was arriving about 80, then even the population was making pressure. And then you had a political decision, okay, let's think about lockdown and let's control the movement at all. And it's very bad, because then the population do not believe anymore or adhere anymore to such changes the whole time, so you lose credibility. And when you lose credibility, it's very hard to take a public health measure to get our population in. So along the pandemics, at the very beginning, we were watching the mortality increasing. And it reminds me when I saw for the first time 1,000 deaths in Italy, I was crying in front of the TV. But I couldn't believe that we arrived at the number of 4,000 deaths per day. It's amazing, and you cannot describe the feeling as a citizen and as a health professional to look at something like that, and something that we could prevent, we could reduce, we could mitigate somehow. And so a long time the policies were changing. And yes, we had to invest on the vaccine. And so there was a movement in Instituto Butantan from São Paulo with China, and from us, from Fiocruz with AstraZeneca Oxford vaccine, to start production and yes, to vaccinate our people. We in Brazil have a very strong tradition on vaccinating. We have lots of capillarity all over the country because of the unified health system, but we didn't have vaccines. We couldn't purchase vaccines, and we had lots of political troubles to buy them. So you have the access first time, because everybody was purchasing, and the rich countries were just wasting vaccines, whereas the other countries, the South countries, couldn't access. And then it's really a trouble that we will comment a little bit afterwards. So our big plan was vaccination. And we were, okay, the plan was in 2021, we would start vaccinating with contribution from São Paulo, from Fiocruz, and from COVAX, that very lately we were entering the COVAX facility. So at the beginning of 2021, we started vaccination. And then I think we have like a graphic on the right. It's amazing. The effect is really amazing because about July, we started on January, about July, we had a huge decrease. And the most beautiful data, I would say, in this graphic is that when Omicron had been introduced, it was in December of 2021, and we were very happy because the incidence was very low. And so we thought we are free. There were lots of parties that Brazilians do beloved that. And then on January, it was an explosion of cases that everybody saw, lots of services breaking down, a huge confusion, but our mortality for the magnitude of Omicron wave was extremely low. So it was a really sustainable response. And that's why everybody does love vaccines. That was a perfect effect and very fast. It's a very important point that we should invest because that's the way. And very fast as well, we were able to produce a vaccine. I mean, we, as a global effort, in a few months, I would say, compared to 10 years before, usually we do need to develop a vaccine. And so only like a closing, showing in other form that although the incidence kept high, especially in 2022 because of Omicron infections, the mortality and lethality just dropped down significantly due to vaccination. And then, okay, we have a good experience in the other hand, fortunately. And so I would like to use the Fiocruz as an example. We are a public foundation, non-profit foundation. And inside the same administration, we have an ecosystem that's working out. And so we have research, development, and innovation, healthcare to reference hospitals, that it's extremely important not only to study and evaluate and make guidelines on clinical protocols, but for clinical trials as well. We have two factories, one for medicaments and the other one for kits, diagnostic kits and vaccines. It makes all difference. I wouldn't read everything, but the ecosystem, that's the way, because we have to have everything integrated to really respond in a fast and efficient way. Otherwise, it's almost impossible. So it's a very micro universe that is telling the same that you were talking about in another universe. So we need to have cooperation between all areas. There are complexes, challenges that we have a multidisciplinary answer that we need all these parts all together to really build up a good response. And so only very fast, we were able in Fiocruz to respond from surveillance to education. And in that time in Brazil, we had many troubles with the Ministry of Health, and the Fiocruz in the end assumed a part of this role of Ministry of Health role with the scientific community, with the population especially, and with a special attention to vulnerable populations. So besides that, there was a remarkable changing, because up to this point, up to COVID pandemic, our funding was only based on public money. On COVID pandemic, we had a consortium that not only public, but also private money was invested very, very heavily. And so we were able to improve our infrastructure with a new hospital, with a new factory, with 4 centers for high throughput diagnostics and many other conquests. In the end, not only from this consortium, but it's a huge combination. We are building up, we'll build up a new campus that will be extremely important for Brazil preparedness for next health emergencies, because we would amplify our capacity to produce vaccines, even to respond to PAHO demands as a hub for mRNA production of vaccines. And so just at the end, to finish, lessons learned, what we need, what we do need, the commitments, and to go ahead. Political and governmental commitment with science and public health for decision-making based on scientific evidence. It's very hard to fight against the pandemics with an anti-science government. To reduce inequity, it's not possible to cover a part of the globe and the other one has access to nothing. We will see again what we had seen with all the variants of concerns for SARS-CoV-2. Efficient and accessible communication, yes, we have to learn how to speak directly in a language that our population understands. That's the first part. The second part is we live in a fake news time. It's very hard. We had a historical tradition to adhere to vaccination. Since COVID pandemics and all this fake news, because you will take a vaccine, there would be a chip inside of you, you will become an alligator. It was the most crazy things you could even hear about. But the fact was, people was not searching vaccination. It was amazing for us that has this historical tradition. So it's very important to communicate in an efficient way. Steady surveillance systems, since early systems and monitor the whole time tendencies. It's an epidemiological intelligence. It's very important to follow up systematically. Otherwise, we cannot see the trends and really to have a window, a timely window of opportunity to really intervene, especially with new pathogens, re-emergence, and so on. A comprehensive response, a multidisciplinary response, and of course, nobody makes nothing without money. And so the sustainability of all these ecosystems depends on investing regularly in R&D, because everything starts here, since basic research to social evaluation of all effects, epidemiological intelligence, of course, and capacity building, not only infrastructure, but skilled personnel. And finally, the One Health approach is absolutely necessary otherwise, because the biggest risk is really the spillover and the emergence of a zoonotic disease. And so if you don't have, you just control environment or just human health, you won't even see that. And so to finish, in fact, we were not prepared for COVID pandemic to face something of this magnitude. We have a very huge inequity on access, distribution of pandemic-related health products. So, and to add a new element, another element, I would say, we have lots of drivers or threats coming from geopolitical status, invasion, water, lack of sanitation, the entering sylvester areas that we are entering contact with some vectors we were not prepared anymore, and the climate change that is the fruit of the cake. I would say that it's really changing, could change all the epidemiological scenery we do know, and we know how to deal with that. So we can be beyond a totally different scenery. Solutions, way to go. I know it will be discussed afterwards, so I don't need to enter in any details or comments. I would say, I would only finish that that's the moment for a very intensive advocacy and support for the pandemic treaty. Otherwise, we will not be able to really respond globally beyond all the challenges we do have. It's not a question of if, but a question of when. So thank you very much, and sorry, I was controlling myself because I talk.
Thank you very much, Lourdes. Thank you very much, Lourdes, for your really comprehensive presentation, where you outlined both the mistakes in terms of policy in your country specifically, and also showcasing the positive experiences. And when I talked to people from Brazil about the pandemic times, really everyone was saying that without Fiocruz, they wouldn't have been able to imagine how to come through the pandemic. So your institution is really crucial in showing by good practices and all the measures that you outlined, how from an institution you can really address critical problems. I would now invite Anthony Plasencia to the floor. He's member of ES Global and also member of the European Global Health Research Network. So we jump back into the European region and invite you also to say some words from your perspective.
Thank you very much. Good morning. Buenos días a todos y a todas. Guten Abend. It's a pleasure to be here on behalf of ES Global, not only to share a few contents, but also to the organizers for the possibility of adding up institutionally to this effort and to this exchange of experiences, and I would say commitments also for the future. So I come from academia. The Barcelona Institute for Global Health is an academic institution, a research, translation, and education institution, as we like to say, which is a little bit the result of a shared effort between teaching hospitals, their affiliated universities, or University of Barcelona and Universitat Pompeu Fabra, and their affiliated hospitals, 3 levels of public administration, so the Spanish government, the Catalan government, and the city of Barcelona, and then also philanthropy, one of the few philanthropies dealing with health in Europe, which is GLACIER Foundation. And I've been directing ES Global until January 1st, so now I'm a little bit lighter, I feel lighter, and mostly devoted from my background, which is I'm a physician by training, a specialist in epidemiology and public health, and I've had mixed responsibilities both in managing public health and also in research, namely in health systems at large, and that's a little bit some of the aspects that I will focus. I will just share with you a few, let's say, introductory slides, as we were asked to do, and then I will leave probably the in-depth, more in-depth comments for the debate. So one of the reasons we are here, and I say we, is because my colleague Elizabeth Diago is also here and will speak in the following panel, is that because due to the pandemic, where we had a broad range of researchers in different areas, infectious diseases, chronic disease, environmental health, climate, and so on, everybody really tried to respond from their area of knowledge, of expertise, understanding that nobody knew about coronavirus before. So based on this, there was many developments in research, but also in translation. And by translation, meaning we're an institution that understands research as something that has to have an impact. So, and you cannot impact just out of research, out of publishing papers or out of doing research work, which is of course a necessary condition, but not a sufficient condition. So a significant part of what we do has to do with how do we bring evidence, scientific evidence, to policy, to decision-making, and also take into account society. So basically what we develop is a preparedness hub. You have the web here, dedicated mostly to bringing together research and policy analysis at ES Global, but bringing in also, of course, the international experience, and also developing some technical assistant projects. And by the way, not only in the area of infectious diseases or pandemics, but also in other, let's say, with all hazards approach. So dealing also with nuclear accidents, as we had a team dealing with this prior to the pandemic, climate change, early warning systems, and so on and so forth. And that has meant not only research projects, but also some policy and some translation efforts. So we are at the core of our work. We have somehow synthesized a little bit what preparedness and response and resilience and recovery means. So that's the PR3, okay? And of course, that adds up to a number of conceptual approaches, again, with this significant effort of considering that what we prepare for against pandemics might be also useful for other global health hazards. The second reason why I'm here just is because until a month ago, I was the chair, actually founding chair of EGRIN. EGRIN is the European Global Health Research Institute, Global Health Research Institute network, which is a network that started in 2018 of global health research institutions. You have here our map. Charité is one of them, and Nora Anton, who is in the room here, was just elected member of our board very recently. So it's just, I would like to convey the message in this network role that a number of global health research institutions of excellence, actually 20 from 12 European countries, a number of German institutions also, and our international partnerships, global partnerships, I don't know what that means, but it's something with Zoom. Okay, so anyway, one of the areas that we have been working on is precisely interdisciplinary collaborations and advocacy actions, thinking largely in the European context, the European Commission context. Thank you. And preparedness and response to health emergencies and the EU Global Health Strategy, which was mentioned earlier in the introduction, has been one of the areas, is one of the areas that we are working around the HERA deployment, but also in other positions that we've taken, and we've published a number of documents, a number of papers precisely related with this. So this is just to share with you that there is this network, and this network aims, together, of course, with many other networks, at promoting precisely that the window of opportunity that is rapidly closing closes a little bit slower, or doesn't close too fast, and I will go back to that. So a few slides just to synthesize the many things. I mean, we've had a tsunami like never before of scientific evidence in all these years, in these 4 years. And of course, it becomes very difficult to synthesize all these. And I'm just talking about the scientific evidence, of course, not the news and the many other information events. But I like this summary, which was done rather recently by a microbiologist originally from Cuban origin, but who works in the US, some Arturo Casadeval, maybe some of you know, he's at Hopkins. And he mentioned these 7 evolving things from a century of pandemics. And let me say that the COVID pandemic has been, until now, the most disrupting and the most serious crisis of the 21st century, but with a mindset of the 20th century. And that's part of the challenges. Things are changing very rapidly. And it's important to understand a little bit to put this in perspective, but it's as important to look forward as we're trying to do here today. So one, pandemics are unpredictable, but let me say one of the expressions of the French sociologist, philosopher Adrián, who say, expect the unexpected. So even if they are unpredictable, you should expect them and be prepared. And we'll go back to that. Most pandemics never end. So in fact, the COVID pandemic is officially over, but it's not epidemiologically over. And we all know cases around us of recent infections, hopefully, especially if they have been vaccinated with not serious health consequences. There's a need to have a continued investment in science and preparedness, and that this should be seen as an insurance. And it's amazing because we pay insurances for many things, both governments and individually, but we don't see sometimes preparedness as an insurance for the future, and we should see that. We pay, by the way, firefighters as an insurance and a prevention largely for fires. So why shouldn't we do the same for health? We have, it was also mentioned earlier that we will have new infections, which we don't even know probably what type of pathogen this will be, and they will have the greatest danger because they will find naive populations. We will have to bear in mind. Oh, sorry, because I'm okay. I tend to move a lot because I teach. So, yeah. Okay, thank you. So we need to bear in mind human nature, because at the end, that's what makes the difference between having things happen or not. And this we know a lot. And I say we know a lot, but as you know, social sciences and knowledge brought from social science has been, at least in the early phases, was left out largely. I'm generalizing, of course, and that's a lesson that we need for the future. We need not only being able to understand scientific evidence, but as I was saying, the advances in social science and communication. By the way, again, a challenge is, and it was referred earlier by Felix, I believe, which is the challenge of linking scientific evidence and policy decisions. And again, you need to be prepared for that. That's not something that you mount in a few days in the middle of a crisis, in the middle of the war, if you want a health war. So you need to have stable, systematic, well-trained and somehow prepared processes of interaction between science and action. And finally, as we know, climate change is not going to help in this context of unpredictability. So we need to bear in mind, and of course, that involves, as any health determinants, for those of you who have a public health background, health is something that goes beyond health systems, and health determinants, of course, are in many settings and with many actors. And we know that some of the initial slides on the bottom axis is the Global Health Security Index score, which is one of the different scores of preparedness. And we see the death rates in the initial phases of the response. And what we see here is that some of the countries that apparently scored best in the initial phases also had the highest death rates. Okay, so one could say, well, where's the problem there? These guys scored really well, but unfortunately had the highest death rate. So is that preparedness was just on paper? Is the type of preparedness that doesn't respond to their needs? But on the other hand, we see that other countries throughout the world had higher scores with lower death rates, and also countries with lower security scores had also lower mortality. So one of the challenges is, how do we measure pandemic preparedness, and what implications does this have in order to evaluate what works and what doesn't work? And one of the initial, this is by the global monitoring board, pandemic board, that in the initial phases said that the majority of the recommendations that had been made before the pandemic were never implemented. So it was on paper, but not in real life. That lacked solid preparedness plans, core public health capacities, and multi-sectorial coordination. And that a significant part of it had to do with political leadership, trust, and in government and country ability to mount fast and adaptable responses. This was early in the early phases. So in the meantime, early meaning 2021, so the second year. But there's just some issues that I like to raise, and that hopefully in the debate we will expand. One is we're dealing with complex problems, again, 21st century issues, and that needs a systemic and integrated vision, which is not easy because that means lots of conceptual approaches, different disciplines. So we need inter and transdisciplinary knowledge, and we need also, because that means many actors, many of them don't talk to each other on a regular basis, meaning from different sectors and from different levels in society. So definitely that's part of the complexity, and that's part of the difficulties in identifying why preparedness worked or didn't, and why and what we should be focusing on. So that means that we need to bear in mind preparedness, response. They have different terms. Frameworks need to be comprehensive, dynamic, very important. One of the criticisms or difficulties in interpreting what happened is that things change and responses change. And as we know, the epidemiology of the infection, of the COVID infection, had different waves throughout time in different places throughout the world. So that's important. And of course, metrics will be very important if we want to advance here. The third message, and that's largely my area, is health systems. Earlier, we were talking about vaccines, diagnostics, access to. If you don't have an effective health system, you won't have an effective tool. So sometimes we tend to, and we see the discussion, for example, in the EU context, that the discussion focuses largely on HERA, the Health Emergency Authority and Response Authority. HERA focuses pretty much on vaccines, diagnostics, and treatments, which of course makes total sense. But if you don't have an effective, reasonably well-working health system, from governance to community participation, so with all in between, financing, service delivery, technologies, manpower or workforce, those supposedly, or those in principle, effective tools will not be efficient because they will not reach the people. And so that brings the issue of equity. So very important in preparedness, we need to bring in the issue of health systems, not only as the providers, but also as the leaders of the process, or as co-leaders of some governance process, which, as we've seen throughout the world with varying versions, somehow we've seen that governance is has been a key issue, good and not so good governance. There is a need to apply the evidence on, and when what looks at what's published, we see that a number of works, it's a little bit difficult to identify quality evidence in terms of what worked and what didn't, but that's important to bear this in mind. And finally, at a time when the window of political opportunity somehow is shrinking, at least that's my opinion, it's probably the only opinion of this slide, where we have now this landscape of polycrisis, that it is called, and this is dispersing a little bit. So it's amazing that somehow what was the shock of the COVID pandemic is closely forgotten. And let me say that we have the duty of memory, not only technically, scientifically, and institutionally, but also emotionally, because that means 29 million people, and all of us know some of these 29 million people, at least. And so I was just quoting the director of WHO saying that at the last sentence, an advanced medical system is not the same thing as a strong public health system. So when we're talking about health systems, we need definitely to consider that it's not just advanced medical, you need a working health system. For example, you can have great tests, but if you put them all in the hospital, as was the case in the initial phases in Spain, and you have a lot of asymptomatic cases, which should be seen in primary care, then you need, therefore, to have your primary care prepared. So I'm just closing with some implications that I guess will come up during the debate. And others have mentioned earlier. Surveillance systems, of course, access, the infodemic, and the complexity of dealing with fake news, the public health capacities. By the way, meaning that public health capacities should be dedicated staff. So people who only do this, not people who do this when there's a crisis, okay? You don't have firefighters doing home repairs and then extinguishing fires when there's a fire. Firefighters are prepared and are fully dedicated all year long, and we pay them generally with public funds. We need global governance, of course, and the pandemic accord in process, I would say, is still an opportunity that we should be working on. Of course, the challenges of metrics and evaluation, and the issue of expand multidisciplinary and interdisciplinary research, and also, of course, in this effort, global cooperation. Equity and sustainability is fundamental. And let me close just that in bringing together some of the global health areas of development, it's key to link global health security, so preparedness and response, with the developments dealing with universal health coverage, which is something that all countries deal with, and also with health promotion and disease prevention. I'm saying these are some of the large avenues of health reforms. where definitely preparedness and response needs to be inserted and needs to be synergistic. So I will leave it here. Thank you very much.
Thank you very much, Anthony. As we are following along with your presentations, I think the picture is being like complemented with your perspectives and with the implications that you draw and the lessons that you draw. As the last speaker, I would like to invite Juan Carlos Ceballos Lopez to the floor. He is currently the Dean of Faculty of Health Sciences at the Universidad Espíritu Santo in Ecuador. But also he had made the experience to being in charge as a minister during a very, very sensitive and difficult phase of the pandemic in Ecuador. So he will certainly also share with us the view, the perspective of somebody who is actually taking the responsibility for making difficult decisions under difficult circumstances. Thank you very much for joining us.
Gracias, Ana. Good morning to everyone. Thanks for having me here. Thanks for Felix and Andrea. Andres Moreira Soto, who invited me. Thank you, Adrián and Laura, for preparing all of this. My perspective is a little bit different. I was in charge of running the ministry 2 days or few weeks after few weeks after the pandemic breakdown in Guayaquil. 702 people have died in 1 day. Guayaquil was hit enormously. And I was listening to Maria Lourdes that says it were 4,000 in the whole country. There was 702 in one city. And that was terrible. So this is something that I got a few days ago. 704 million causes and 7 million of people died. There was a pandemic. And I have to refer some of the statistics that comes from the Johns Hopkins. And that this is the disclaimer. I didn't make that statistics, but this is what happened. And of course, you can see against many of the practical issues that people from my own country, physicians from my own country, were against accepting that there was a pandemic. That was a reality. Where are we now? Anthony Fauci is or has been called to the Congress in the United States to explain that. What a pity. ¿Dónde está Fernando Simón? I talked to him a couple of weeks ago and he said, me inmolé. That means I killed myself because of the pandemic. We can debate that afterwards. 2 of the ministers closed in Peru and Colombia. One has demands for 30 demands, and one is against humanity. So if he finds guilty, he will spend the rest of his life in prison. And another minister is already in prison. And they didn't recognize that this was a problem. So there was a problem. And we faced that. And the 702 people that died 1 day in Guayaquil, we couldn't bury them because WHO didn't want us to bury people. That was the end of March of 2020. And WHO came, I'm sorry, that was February of 2020, and March 11th was the first time that WHO says, yes, you can bury death corpses. And the capacity of Guayaquil to bury those corpses were 7, plus 5 in the surroundings, 12 people. What do you do with 702 people? And what Felix presented in that picture is just a snapshot of the terrible thing of having a mom, a daddy, death in the bedroom, and after 2 days put in the living room and then in the sidewalk. That's what we faced. And it's not only a problem of vaccines. We have short memories. We couldn't find from WHO again, from PAHO again, a clear definition of what was the usefulness of the mask, of the facial mask, or social distancing. And we face extremes, like a very mentally ill person in Guayaquil. The mayor of Guayaquil shut down the airport and did not allow Iberia to land. And Iberia was without passengers just to pick up the Spaniard population there. These are the things that we were facing. And these are some examples. I have a few slides of what happened with Peru in the upper part. I don't know if we have a slide here or a pointer here, but look how close we still are, Ecuador and Germany. After the 702 people who died at the beginning, we made a complete difference in terms of the heat. No, nobody did it well, and don't take me wrong. I was responsible for most of the decisions. And the only common thing that I had with Fauci is that we both worked at the CDC at some point. And he opened some of the advice and everything that we use as an evidence, as a scientific evidence to make decisions, something that in most of the cases did not work. Not to WHO, not with PAHO. Among us, among people that you know. And we had the visit of Felix and Andres from Charité to Ecuador in one of the most important crises. But we did it well after the very first part, and you can see the rest of the countries. And that's again is something that the universities at Johns Hopkins prepared. And again, you can see the amazing difference in the bottom are the dates, and then the daily new confirmed dates. And we can say, yeah, you can hide the new cases, but what about the deaths? Where do you put it? You have to inform them, and that's why it was very different. This is United States. The green line that goes up that you can see is the United States, but you can compare to Brazil, Colombia, and then Ecuador, Peru, and Bolivia in the bottom part. And that is December 2020. Yes, we did a good job. But I had to spend 1 year in one of the most important jails and most beautiful jails in the world, that is Brickell in Miami. Because the National Congress, the Ecuadorian Congress, pushed me out of the country. I couldn't return for 1 year. And again, it was a very nice jail, but was Brickell, was Doral, was Miami, was very beautiful, but a jail anyway. And then it comes the deaths per million. Again, Ecuador is one of it's down in the bottom. And that, again, it's December 2020. What we did differently, not perfectly. We made lots of mistakes. Again, we did not have clear evidence that what things were working or not. The very first thing is the active participation of the private sector and academia. So I had the pleasure to know and work with the private industry was telling me exactly a tomato that is collected 120 kilometers away from a restaurant, let's say McDonald's, where that particular tomato was cut and served. And that's what we use in order to distribute the vaccines. We were the second country in Latin America to receive the Pfizer. Why? Because we came to New York to say, please, begging them to give us the vaccines. We never used the Sputnik 5. That was the mistake in Peru. The Sputnik 5 was used, and a lots of deaths. And I'm just saying that nobody has addressed that issue. The Sputnik 5 did not work and caused a lot of deaths. And we didn't have the capacity that Brazil had later on. We were the first country, I'm sorry, yeah, it's working. We're the first country That's fancy. In Latin America to bury dead corpse. Vaccination used private sector logistics. And we were one of the countries that vaccinated most population worldwide. Cases were controlled at the community level. Point number 4. We do believe in what is called the médico del barrio, the community leaders and the technicians. We advocated a lot for community primary health level. We did not control, as opposed to Europe, most part of Europe, most part of Italy, northern part of Italy, even the United States, Florida, the hospital, at the hospital level. We were at the community level. We reactivated all the small clinics in all the community, in every single city. We're in a situation where the physicians didn't want to go to work because they could be contagious. And what we did is, yeah, we really covered their experience, and we provided a lot of handmade masks, for example. We couldn't import masks. Remember that Trump, or President Trump at the time, forbidding the exportation of masks. We're not talking about vaccines, but masks. We had to make our own masks with all the risks that it means. And the physicians in my country were contaminated through birthday parties, through celebration, and not at the hospital level. And that's something that we need to say again. We need to say it clearly. So the activation of the médico del barrio, the community leader technicians that worked that are part of the community was essential. And again, I have to reiterate that primary health is extremely essential. We're trying to get down the curve. And we were happy to send these messages that, okay, you're doing okay. We have to do the social distancing. We have to use the masks and so on. And in conclusion, I have only these 2 things. We did not have a good general worldwide international guidance, except for the very specific items that I have mentioned. WHO was absent, period. They didn't know when to say it, if the masks were working or not, if social distancing was working or not. If there was not for the autopsies that were conducted in Switzerland by Italian pathologists against the WHO advice, and discovered that the problem was not only in the pulmonary system, but mainly in the cardiovascular system, we wouldn't be able to implement a lot of medications and everything to mitigate and to prevent that. And perhaps this is the most important one. Academia and private sector must be part of the solution. We cannot get alone. And I'm very open to any discussion that comes further. Thank you.
Thank you very much, Juan Carlos. I think all of us are happy to have you back from jail. I think it was very impressive evidence that you also shared with us. We have proceeded quite quickly in time, and I have prepared the question to all of the panelists, but I would like to offer you here in the auditorium, and also our participants in the online platform, the opportunity to ask a question or to comment on something of what you heard. I don't see a hand that is raised. So, yeah. Please present yourself just briefly.
Good morning, everyone. My name is Liena Schbin. I am a PhD student from Professor Drexler lab. Well, my question perhaps is more aimed to Professor Antoni Plasencia. I was wondering how to become science in a co-leader of policymakers when we have to face challenges such as politicization of science in one hand, And in a second hand, the skepticism of people about science because the influence of social medias. That's my question. Thank you.
Are there more questions directly? Okay, Anthony, you like to respond?
So thank you very much for your question. Let me just share an opinion, which in fact I would like to connect with what Juan Carlos was just saying, which is the importance of building connections in times of peace. And connections can be at many levels, of course, private, public, but also science and policy. So what you need to have, or what is ideally, is to have regular interactions, let's say with an agreed methodology of interactions between science and policy in times of peace. So therefore, when a crisis appears, things work in a reasonable, of course, tensions and difficulties and uncertainties, but somehow you have already the basis to continue working on this. Every country has its model. For example, just in Spain last week, it was presented by actually the president of Spain, which is the prime minister, which was the Office for Research Assessment to the government, okay, which I won't go into the details, but what that means is formalizing something that is already developed in other countries. So I just wanted to use this example because it's one of the applications of the lessons learned, in this case, from the Spanish government. And Fernando Simón, who I just mentioned, happened to be a technician in charge of emergency response or preparedness, public health response, but was not the chief scientist. There was no chief scientist in Spain at the time. And there was no scientific somehow organization with somehow a practice of interacting with politicians, which, by the way, it's something more than say, these are the papers, this is the evidence, now you act. It's much more complex, as we all know, those who have had interactions at the policy level. So again, each country, each region has to build its own interactions. And I would say largely it's about building networks, and it's about putting these networks to work on a regular basis already in times of peace. And we can discuss later maybe some details of the lights and the shadows of this process.
Say your name first.
Hi, everybody. My name is Vladimiro Rincon. I have a question for the last speaker right now. I will be happy to hear that probably, from the Spain, from the Institute, Anthony. I will be happy to hear, I know you are not anymore the president of the association or something like this, but I will be happy to hear that you open the doors also for Latin American countries and institutions there, because as you see, the statistics was very hard, and many of the new pandemics probably coming from such a kind of places, no? And go to Europe and North America and create a new pandemic. And then we are open to collaborate with the European community, of course, and be associated with such a kind of new institutions and so on. Thank you.
You want to react on this?
Well, no, I think it was a comment, but absolutely open. Actually, my colleague will explain in the following panel some of the interactions that we're having, especially in the area of surveillance in Latin America. Again, it's about building bridges, and the bridges is the way you cross a little bit the holes or the difficulties, and that needs to be done at many levels. I know it's a very broad statement, but also I think, for example, since we're talking in Germany has a very significant momentum in global health, which started by having a global health strategy. And maybe if I'm not explaining well, you will correct me, and Nora is there also. Having a global health strategy, by the way, not only done by research or by policymakers, but involving the private sector, civil society, and so on. And then building from there interministerial relationships, stakeholder relationships, putting some funding, by the way, because nothing is free. And right now, I think this is definitely a model of reference that with whatever adaptations, and maybe again, there's a small, the small typing that you know probably what works and what didn't work. But I think, again, all countries should strengthen all these bridges at the different levels. Okay? And of course, we're open at EGRIN. We have the status of associated member. And of course, we have many interactions also for the case of ISGlobal with Latin American partners. So absolutely open to explore further interactions. Okay.
Thank you.
Yes, hello. Thank you. Bert Hoffman from the GIGA and the GLACIER project. One question for you, Maria, from the Brazilian experience. You mentioned there's a federal state, and Germany has also been a federal state, or is still a federal state, but in the pandemic, we had the experience that we had kind of a patchwork of regulations from the different federal states, and that did not exactly foster trust, because people said, well, why in Bavaria is it that way, in Lower Saxony that way? And in your case, obviously, it was a bit different because you had a president who was unhelpful, to say the least. But what was your experience with the result of federal, subnational level policies in terms of trust building with the public?
Take one more question, perhaps.
Hello, good morning. My name is Carla from the Embassy of Honduras. And first of all, thank you so much for letting us be part of this event. It's a great space in order to share all the experiences and the challenges that all different countries we have been able to experience, sadly, through the pandemic. And this question is following the line of thought from the first question that was addressed to Mr. Plasencia. And it's related to what was mentioned about health, the relevance of linking health policies with the health system and the models that you were mentioning before. So what would be some suggestions in order to promote this knowledge sharing in order for all of the nations to be able to learn from the experiences and models that are actually working abroad? Thank you.
You want to come, perhaps, so that the people also in the platform see you? Okay.
Well, exactly as, thanks for the question, but exactly as you said, we had a very auspicious political situation in Brazil exactly in that time. So I'm here speaking as Lourdes, a Brazilian citizen. Yeah, it's not representing Fiocruz' opinion. It was very hard in such a way that the states, they had a committee of every health secretariat has voice, and they have votes. And this forum was conducing internal dealings despite the federal government. So it was politically schizophrenic, and it was very bad for orienting the population, because the federal government was telling something, and this forum and council that was basing their decisions on the data we did have, they were telling something else. A practical example, a long time, the Minister of Health stopped informing the Brazilian data, epidemiological data, that you must do, it's a question of protocol for health emergency, you must do regularly. And so the press, the Brazilian press, they made a consortium, and they were consulting this forum to get the data, to put at the newspaper, and it was our source of information for a while in Brazil. So how to do surveillance if you don't have the heart of it, that it's data, robust data. So we do have gaps that I think we are still not able to measure. I mean, notification gaps, breaking the system, changing criteria for death classification a long time. It will have an impact on our policy, the design of policies. And so, in fact, we had the country or the federal government and the country that was trying to survive as a consortium of states. And in a moment, it was led by São Paulo that had the first vaccine, produced a vaccine and was vaccinating our population. And also as part of this system, Fiocruz was entering exactly in this gap because we had lots of capacity and experience with previous health emergencies and groups that are specialized to talk to population somehow in an easiest way. And so we were at the TV, at the radios, interviews, everywhere with the Health Secretariats Consortium to try to do the best we could. And so that's exactly what happened in Brazil along pandemics, in pre-vaccination era, especially because we don't have how to really control. In fact, we did the best we could. That was too far for what we could have done. That's the point. So thank you for the question. Felix? Yeah.
You want to speak just to the point?
Just to say that, no, it's okay. Do I have to use the microphone so that they give me the Zoom? Thank you, Lourdes. But I mean, bear with me. We know that a part of the Brazilian landscape was so complicated because it was different political parties opposing the president and different governors.
Mm-hmm.
So this was a huge problem, and it's not just a Brazilian problem. We have seen that sort of self-acclaimed mostly populist right or left-wing governments in Latin America have refused to work with one another. There's several examples. And so I mean, or maybe it's a question for you and for Antoni. So, and joining this, so if we have a total populist movement taking over entire governments in Europe and in Latin America, it's not, again, we have the same in Europe. It's apparently global, unfortunately, global movement. So how do we build in peace times chief scientific officers that would listen to populist governments to be elected? And I from my point of view as a health person, I could not care less if they are self-acclaimed right or left, as long as they work for the better, greater good. But it just has not been working. Please comment your ideas, how this should, what's the way forward then?
Well, thank you. If I can add to this debate, by the way, Spain is also a quasi-federal country, and we had some of the challenges. Maybe the difference is that people in charge, politicians in charge, were not scientific deniers. So actually, maybe some of us were a little bit critical, but because they were using science a little bit too much to justify decisions. And so it's sometimes the narrative was, scientists have told us to do this, so we do this. And it was not exactly as straightforward. Again, I always say that preparedness is about trust, building trust. And how you build trust is one of the challenges of our century right now at many levels. So I don't have an easy answer, except that you build trust, again, in times of peace, and you build trust very proactively, and you build trust also based on results. We're surprised a little bit at some of the decisions and the political options that some countries take, but things will happen and there will be some results. So this, you need to have people to face this. And additionally, I think for the case of Europe, since somehow I'm here part of the European ecosystem, one of the major drivers of current, although weak, European Union identity has been the response to the COVID pandemic, especially not exactly in the first stages, but very soon, very early on with the vaccines, with the diagnostics, with the sharing of information, and with the interaction with key stakeholders globally. So I think we can turn this challenge into an opportunity based on solidarity and self-interest. And I think that since what we're talking about, nationalism is largely self-interest, we have to understand that self-interest can be also benefited from global solidarity. So I know it's very general.
Yeah, only complementing. Yes, I agree totally about it, but there are some other points. First, we don't talk to politicians. And we have, that was one of the main points, communication. Communication to the population is something. Then you are building up the trust because they can understand. And one thing is to talk to a population which has a kind of education level that can understand and process and change the behavior. The other thing is to have a special language to talk to those that even can't write or read. And so that's something that we are facing in South America that very hardly will face in Europe. Second, and so communication with the population, because then it's convincing, it's building up trust and really orientation. Second, communication with the political class. We must be there the whole time, because after this response, for example, every politician would like to be beside Fiocruz, and I helped Fiocruz with money. I helped Fiocruz with power, because then becomes a very good mark, political mark. Let's use it. Let's use it. And it's a kind of lobby. And so if you have a good platform, you can have votes, and that's it. That's something that the scientific community is not used to at all. We are the first to know, I don't like politicians. No. Who has the legal pen? It's not the president. Who is making the laws has the power, because the president must follow up. And in many times, if it was not the Supreme Court in Brazil, they had the solutions, because there was a mess in the executive power. There was lots of misunderstanding at the Congress. So the justice was resolving the questions. It was totally schizophrenic, because one power was entering the other one's seara. How to deal with that? Third, you had vaccines. Come on, you were the rich countries. It's too much more easier. It's easy for an European to talk something like that, for an American. What about us? If Brazil had not Fiocruz and Instituto Butantan, this would not be our figures. It would be too much more harder. And that's the situation of many of other South American countries, and for sure African, because nobody's talking about Africa, but where are the data? Where's the data? Do you have enough surveillance to show what really went on there? And so I think we have lots of gaps, and I agree totally that that's the time to use all this bad experience and the good ones, to build up alliances, to share and to build a cooperation together. Universities, academic, stakeholders, that's the single way, all together. And I think the pandemic treaty is the best way, because if we don't close this agreement in 1 year, we will leave everything again. We will see, like Ecuador, horrible scenes that we had seen in Amazon, in Manaus as well, and we can't forget it. And yes, the window is really getting shorter, because people is forgetting of what we had lived. And so I think it's not all, there's no answer, complete answer. That's something that we must build up together, but it's difficult to compare different sceneries, because not only kind of a political construction, but it's a social, socioeconomic, environmental, cultural. It's too much more than only politics, I would say. I don't know if I was clear. I hope to have the answer.
So thank you very much. I would like to invite still Felix and Juan Carlos perhaps also to a final statement. We have mentioned the global treatment on pandemics, and also Juan Carlos mentioned the not as favorable role of the World Health Organization when you were in charge. So for the audience, perhaps it's an instrument that is currently under the negotiation by all of the 194 states or members, and it aims to improve precisely what we have been talking about: prevention, preparedness, response to future pandemics on a global scale, in order to ensure long-term political commitment, establish clear tasks and procedures, and ensure long-term multi-level support for the public and the private sectors. And there was a deadline that was not met in order to really to draft the agreement, although member states delegates have been working on this draft for several years now. And if it was agreed upon, it will be a legally binding instrument. I think it is worth mentioning, but there are several challenges and bottlenecks, and these are precisely the ones that make different countries refrain from really agreeing on the document. I just mentioned some of them. It's again a divergence in vocabulary. So in the first stages of the draft, there was more political will really to speak about such words as countries shall, countries will do. And now it turned a little bit less imperative, the language. It's now used, words are used like urge or support. There is also the issue of technology transfer and intellectual property. Many low and middle income countries argue that nations that readily provide access to pathogen data should have automatic access to vaccines, drugs, tests, etc. But other countries, mainly those with strong pharmaceutical industries, oppose such conditions for data sharing. Then there's again the question of sovereignty and misinformation, which you also mentioned. There are no sanction tools for non-compliance for now, and countries such as Paraguay and Argentina announced that they would not sign agreements that affect national sovereignty issues. Costa Rica announced that it did not support the extension of the negotiating mandate on the grounds that there was so much misinformation and it led to misconfidence. There were again the bottleneck of equity and access. A major sticking point is the mechanism for access and sharing of vaccines. This mechanism aims to ensure that low-income countries benefit, for example, from sharing pathogen samples by receiving vaccines and other resources. And finally, there is also the issue of implementation and accountability. So if you look at this from your experience, should we look, is the glass half full or is it half empty? What will make really decision makers move towards an agreement? And is it really realistic that it will be implemented as in the direction that all of you would like to have it? I perhaps.
Yeah, thank you, Anna. I think that we cannot stay pointing out what the problem is. We know the problem, what the problem was, and we should continue make any effort in order to make bridges and continue working in terms of communication with WHO, with PAHO, and so on. So I want this to be very clear. But the incorporation of academia is essential. It is absolutely important that primary health should be, it continues to be our diamond, our main concern, because at the community level, we should stop any kind of a spread of an infectious disease or other kind of a catastrophic madness that we may have in the forthcoming years. And the incorporation of the private sector is also extremely important for donations, for things that we have discussed this morning and heard this morning. So I want to give a very positive, actually, attitude or sentence and say we need to continue collaborating. We know that there was a problem, but we should overcome that, and we should continue trying to bring the bridges that are essential for the benefit of the people. That's the most important thing. And yes, I am not a politician, but you should be a politician.
Mhm.
Thank you.
Thank you. So I tend to be positive here because, first of all, there's no plan B. By the way, there's no plan B, so we have to work on plan A. It will take more time, apparently, than we initially thought, and that somehow the commission was the work that was commissioned by WHO and participate and member countries will take more time. But I'd like to bring in something I read not too long ago. It was about public health, and it said, public health will save your life, but you won't even know it. Okay, by the way, your surgeon saved your life and you will know it. Maybe you may even make a donation to the hospital and to the team of that surgeon. It's the same way, likewise, preparedness will save our lives and we won't even know. So definitely we need to work on preparedness. And one thing that is missing, and that is a key element in any theory of change from politics to real life, is the role of people, the role of the communities. Maybe here today, although it was mentioned by Juan Carlos in terms of the role of the physicians, of the community workers, it also mentioned at different levels. That's key, and it's key not only for technical reasons. By the way, our colleague from Honduras asked what is needed. I think what is needed is, from a health systems approach, understand that primary care, community health, public health services are key. And these are, since they are largely invisible, you need the communities, you need the people, you need civil society to really stand for that. And I think that in this whole debate, of course, civil society organizations in the preparedness accord discussions have been there, largely around the issue of intellectual property rights and access to countermeasures. But I think society at large is still not following this debate. They see this as something that is very far away. And that's what I was saying. We have the duty of memory, and we have the duty of somehow we owe it to the people who have died and who have been seriously ill and who are seriously ill today for long COVID, with long COVID clinical situations. We owe them to be prepared, and it will take more time maybe, but I think that's definitely an effort that each country should decline in its own characteristics of how to ensure that society at large, communities at large, are engaged and put pressure on politicians in decision processes like the ones we are discussing. Thank you.
Yes, first, thank you very much for the discussions. It's perfect because that's how we can exchange ideas and build up and grow in along the process. But I would like to leave an optimistic message. When you look behind, okay, we do have challenges and points that you must have, the group, the INB, should try convergence. And they are difficult points because they deal with economical interests, and that's why it's so difficult to really draw an agreement. But if you look at the pandemic treat and you look behind, it's almost unbelievable how much they were able to build a consensus, and that's absolutely fantastic. And then I think it's our turn to involve society, to bring this big discussion. It's a question of survival, and that's it, because especially with the climate change, we have a very huge interrogation mark, and the population is discussing climate change, and this is one element of a very big change that we can face, another challenge. I mean, at the right moment, in the south of Brazil, we are living a huge natural disaster due to climate change. And so these are the challenges we will live, and our population must embrace the idea. When you involve them and you have a popular movement, it's totally different, because then you push you know, all the political class to really make the decision making. And so first, I think we had a lot to thank to INB, because it's not easy to make this kind of negotiation. Second, I think this discussion must really come up and not be only in between the scientific communities or stakeholders, because then you will have another kind of a pressure, power, because it's interest of any of us. And so we will have huge challenges in the future, for sure, due to the epidemiological scenarios and so on. But in the other hand, I think we had some legacies and we learned some lessons. We must still keep on studying in some others. But as my German father used to say, what doesn't kill you makes stronger. And so I think we are moving, and that's what we should look at.
Thanks, everybody. I, of course, completely agree with everything that was said, but since you're all positive, I will go back to be critical. So one of the things, I'm, of course, pro every international agreement that is helping us to be better, to do better. I hope there will be a meaningful tool. Let's see. I said that in the beginning, and we have a whole panel about this coming up, regional networks. I'm like, how do you say, distrustful. I don't trust the applicability, the efficacy of 194 country agreement on the ground, at least a short note, okay? But I think it's a pity to see that we have a very limited, we had in the pandemic, a very limited impact of regional networks, because there are networks. CELAC is a network. The Pacific Alliance that eventually failed, I think, was supposed to be a network. And that is just two examples. Brazil. So I would love to see regional networks. I would love to see something like the Gran Colombia network, where all the former countries that were once Bolivar's united area that share the same population, the same ethnicity, the same problems, borders, would cooperate in pandemic response. And it's difficult to get there. It has not really happened a lot. Brazil is maybe a special case. You are so big, you have so many borders with so many neighboring countries. So for you, a regional network would already be the whole continent, probably. But let's keep thinking about regional networks. And then second and final point, in regional networks, we have to remind the stakeholders, the decision makers, about the health aspects. And that is, of course, how could I dare to oppose primary health? I'm totally with you, but I will give you, just from my piece of cake, an example of how health is not considered in a regional network. We have a project in Guatemala where we look at pathogens in wildlife that is kept, the few animals that are picked up by the police, the smuggled animals, are brought to one in the Selva Maya. So they're big forests they share. Guatemala shares it with Nicaragua, of course, and some neighboring countries, Mexico. So there's one NGO that is completely left alone by the state for animal health. They so they live from donations. If they have no money, then what to do? And many of the animals cannot be put back in the wild. They have jaguars that are born there. They never learn to hunt. You cannot kill the jaguar because all the Maya get upset because you killed the sacred animal. Also, you don't want to kill the jaguar, but what do you do with the jaguar? They have no money. But then all the animals are smuggled. And I had a meeting a few months ago, and I learned a few interesting things. For example, I was wondering who buys those animals. The short answer is the Mexicans. Because that was unexpected from me. I thought that stuff would get, the main recipient would be a much more affluent setting, so in the United States, and which is also happening. But there's lots of people from Mexico who like to have a beautiful parrot or a monkey from Mesoamerican neighbor countries, and then the routes of so many of the Honduras, Nicaragua, Guatemala, and I think one more country, El Salvador, have free pass. There's no border control. You can just go there. So in Guatemala, it's illegal to get the animal, But all the smuggler has to do is drive 20 kilometers with a truck or a van to get free without border control into a country that has no restrictions on animal sales, which is the case. So the whole One Health component is not part of the treaty. They have made it to a good point, which is, as in Europe, you can pass without having to show your passport, which is, I think, very good. But then animal health and pathogens associated with animals are not taken into account, and it goes all the way north. So I think this is something that is not immediately on the agenda of people making those decisions. And so I think we have to be very persistent in bringing those issues. Thank you.
Thank you very much to all of you. I think the presentations were very comprehensive and also complementary, and they staged the ground for all of what will be following in the next sessions. We will now take a break for our invited participants. We will have a short lunch, and then we will come back here at 1:30 and follow up with the next session. Thank you very much.
Thank you very much, Anna, and welcome back. It's always nice to have this session directly after lunch, so I hope we'll keep you awake and entertained, especially since some of you are jet-lagged, as I just heard. Yeah, welcome to today's, or to this first afternoon's panel discussion on networks. My name is Nora Anton. I will take you through the session together with the moderators. I'm the Director of Global Engagement here at the Charité Center for Global Health, and would like to welcome you also on behalf of the center leadership. And I also, or my unit also hosts the secretariat of various global health networks. So it's a very welcome and nice topic for me. I'm also the managing director of a network called German Alliance for Global Health Researchers, short GLORA, which unites over 1,000 German researchers at public research institutions. And yeah, Tony almost mentioned it, but you did mention the German Global Health Strategy, where it fits in really well. Very excited to be here and be with you, because I actually started my career with a bachelor's degree in Latin American studies 100,000 years ago, and a master's degree in European studies. And then since then, for the past 10 years, I've worked in global health. So yeah, very happy to be here and do the session with you. We have very exciting and insightful discussion ahead, I hope, featuring some very distinguished experts. We've learned that global health networks play a crucial role in addressing health challenges and addressing also the complexities of global health. If they work well, they can facilitate collaboration. We've heard before about information and coordination that networks can facilitate, and also coordinate responses to public health crises, as we've just witnessed over the past years. During this pandemic, however, we also saw that the networking effects sort of diminished collaboration, diminished even between neighboring countries, and contacts due to the contact restrictions, even in established networks, became fewer and more fragile. So in this session, we would like to explore what kind of structures do we need to make cooperation across institutions, countries, and regions a self-evident and reliable practice. And this we've also heard before, both in emergency and peace times. How can we leverage structures and methods of cooperation in existing networks more effectively? And how do we also leverage cooperation across region, Europe, Latin America, but also across regional prevention? Before we dive into this discussion, I would like to introduce our panelists just briefly. We have Daniel Garcia Rivera. He's a professor at the University of Havana, where he serves as the director of the Laboratory of Synthetic and Biomolecular Chemistry. And he was actually one of the people of the team of scientists who co-developed the Cuban COVID-19 vaccine. So welcome, Daniel. Thanks for being here. We have Bogi Eliassen. I hope I'm pronouncing this correctly. My Spanish is much better than my Danish. Than my Faro. Yeah, that's horrible. Won't even talk about my Faro. Thanks. So you're the director of health at the Copenhagen Institute for Future Studies, and have degrees in political science and international law from Aarhus. You've also served in several consultancy roles for Ministry for Government, public sector, and companies, and also very active politically in the Faroe Islands, which is, I think we've never had a guest here from the Faroe Islands, so welcome, special welcome to you. Then we have Vladimiro Rincón Orozco, who's a professor at the School of Medicine at the Universidad Industrial de Santander. He has a doctorate in biological sciences from the University of Würzburg, master's degree in basic biomedical science from the University of Antioquia. And he was also very active in the COVID response in Colombia in cooperation with Charité. I'm assuming that's with Felix, probably. Yeah, thanks. Welcome to you as well. And last but not least, Elizabeth Diago, who is a doctor of biochemistry and molecular biology from, holds a doctorate from the Complutense University of Madrid, and previously managed health system preparedness programming at the New York City Department of Health. So also worked across different sectors, different regions. A warm welcome to you as well, Elizabeth. So thank you all for joining us today. We'd start with a short introductory statements as we've discussed, and we would like to ask you, the panelists, for a brief statement where you share your personal experiences. So maybe you would like to provide an example of a global health network that has been particularly successful in addressing a major health challenge, or if that's not the case, just please share your personal experiences, why this topic matters to you, what maybe your ideal global health network look like if you could just invent one. And I'd like to start this time with Elizabeth.
Thank you. Thank you for the opportunity to participate in the meeting. So I am not actually going to share a network that has solved a problem at global health, but I would like to talk about a network that we have started working together in the Latin American region. That is the Observatorio Epidemiológico Iberoamericano, Ibero-American Epidemiological Observatory. During the 23rd summit of the chief of states and the presidents, prime ministers of the Latin American region, it was decided that it was required a mechanism for coordinating and strengthening the response to the COVID-19 pandemic. So with the SEGIP, that is the Secretaría General Iberoamericana, they received the mandate to start this type of mechanism in order to create a network that was able to disseminate the responses and the protocols that there are in the Latin American region for the preparedness for infectious diseases, to strengthen the regional capacity to respond to other health or epidemiological crises. So it was encouraged that this type of mechanism was going to encourage the knowledge sharing, capacity building, and creating this type of alliances. So the strategic objectives were the management and exchange of knowledge, integrate, generate, develop, and disseminate scientific knowledge and technological advice through the exchange of experiences and information and collaborative networks, the management and coordination, strengthen the permanent coordination and periodic updating of the preparedness and response capacities in the region. And it was not only involving the authorities in the Ibero-American region, but the ideal was to involve also technological and innovative sectors that are focused on health, science, and innovation. Also, the contingency management in order to be able to identify, build, and enrich and communicate strategic preparedness and response plans, and the management of communication and continuing education and innovation, promoting the training of human resources that are the ones that are going to be responding and management the surveillance systems in the region. So we had 2 meetings last year with the technical secretariat that is formed by the RIMAIS, that is the network of interministerial Red Interministerial de Aprendizaje e Innovación e Investigaciones en Salud. So it would be the network of health
innovation, health research, and education from the different ministries of health in Latin America that belong to the CEGIP. During these meetings, we created a working plan of the things that the IS Global and this REMISE would be working together in the next year in order to facilitate and to start working in this mechanism. We are right now identifying the needs that the different regions have in preparedness and response in order to prepare a plan, a proposal that could be applied to different funding mechanisms that later you will be talking in the next panel to receive funds to be able to close the gaps that there are in this coordination and knowledge sharing of information in the region. So this is a starting point, but we will need the will, the political will, and the technical will in order to advance in the creation of this type of mechanism. But, yeah.
Thank you very much. It's working, right? Yeah. Yes. This initial statement. Yeah, thank you very much. I think that's a very interesting mechanism. That's hosted by IS Global, is it?
We are part of the technical secretariat with the REMISE, and it is promoted by the Secretaría General Iberoamericana.
Yeah. Thank you very much. Vladimiro, why don't you go next and tell us about your experience with your network or with your DREAM network?
Yeah, well, I have to say that I am very lucky with the cooperation of Charité and also the German government, because when the pandemic starts, nothing was done in Colombia. The capacities of the molecular diagnosis, also even rapid tests, was not available in all 2020s. And suddenly appears somebody from Charité, in this case was Felix, and start offering through binational cooperation with Colombia several kind of tests, either or both molecular and this rapid test for COVID-19. And this was a very useful cooperation that was bring to Colombia especially, but also benefits parts of the countries where all these kind of diagnoses were kind of absent, and many vulnerable population was living there, even Colombian and also migrants. We are a higher reception of migrants in South America, more than nearly now close to 2 million of migrants that are coming to Colombia since 2019, from 2016 to 2020s. And this cooperation have long lasting, I have to say. With the cooperation from Charité, we still continue working, first start working with the pandemic in COVID-19. And then we, in addition to COVID-19, study also what is going on with infection of transmitted diseases, and also what is the problems more prevalence between the maternal and the child in this kind of duet between child and maternal. And that's have been working really efficiently due to the collaboration with the GLACIER and BMBF. Means all the fundings that we have and all this long-lasting collaboration that we have now since 4 years have been working through or start the collaboration with the COVID-19 pandemic. And due to the good results and good communication between researchers of 2 research institutes, once in Colombia through my university and here with the Charité, where we were able to continue doing the collaboration. Unfortunately, I have to say that the communication with the national institutions that are led by the government sometimes are good, sometimes are bad. At the beginning, we create also with the help of Charité and GLACIER a network for doing sequencing to virus sequencing of the COVID-19, and do this kind of studies, just of course to see which variants are arriving in Colombia, how they develop and so on. But suddenly, the pandemic was declared going to finish and all disappears. The technicians disappears, the government disappeared completely from the horizons, and only the universities that were implied on this kind of networking try to continue doing this. But all the things that I hear this morning that is necessary to keep going, doing the interests, put inside the politicians, put inside the government, for them, in my eyes, in Colombia, they are not really interested at all. Or only the academics that we know that probably the next pandemic coming or the next influence coming or probably another that we have now with another arboviruses like dengue, oropouche, and so on, doing a lot of problems in Colombia and all South America are really keep working with the resources, international and national, that we can get it, but we don't see it from the government really any kind of interest. That's why I asked today, it's nice that you open probably the door. If it's not able to open the door, at least the windows, just that have a cooperation, because with Charité, everything was working fine and we are good partners to do it. And all Central America and South America are doing a good jobs, have a good facilities, had good, well-trained people there, just to see these collaborations keep going. But with the governments, I see really, it's not really a long-lasting collaboration possible, because we change quite a lot. No? One day have some interests, another day have another's, and this is a pity. But this is only my opinion, of course, that I have experience with the German government and all this kind of binational relation between Germany and Colombia, and that is the reality for me.
Oh, thank you very much. Yeah, I'm afraid we might be facing this here as well, that interest in the global health and the international is actually fading away since other crises are emerging. But I would like to hand over to Daniel as our next panelist. Please, what networks are you involved in and what are your experiences?
Well, good afternoon. Good afternoon, everybody. I would like to share a little bit the experience that I have with regarding the vaccine development field in Latin America, and how the cooperation with Germany is helping to advance that field, at least in the Central American region. No? But before that, I have to mention, I have to be honest, that the perspective for Latin America to become a hub for producing vaccines is not very optimistic, so we have to be clear. When we listen the politicians, the Latin American politicians, but also the European politicians, what they talk about, and they all talk about all the actions that we have to do to improve production capacities in Latin America, which is nice. It sounds nice, but the action that needs to be implemented to achieve that are never done. And in the morning, we listen the word manufacturing. So for politicians, what we have to do in Latin America is producing vaccines. But what they actually mean when they mean producing is building factories that fill up all the vaccine vessels to sell to our populations. So they actually don't mean development. They mean manufacturing. And this is not what we need in Latin America. This is the reality. So if we keep relying on Europe and United States for them to develop their vaccines, and then we only produce the vaccines that they develop, this is the path that we don't want. And this is the path that we have been taking for the last 40 years. So Latin America actually did have an important production capacity for vaccines 40 years ago. Many important countries from Latin America had it, and we lose them, all of them. The main countries from Latin America, with the exception of Brazil and Cuba, because Cuba is small and has this embargo that could not purchase vaccines in the international market, kept those capacity for development. But Colombia, for example, lost the vaccine production capacities, Mexico and many others. And there are many reasons for that. One is political reason. The other one is economic, of course. You can purchase now cheap vaccines in India, for example. And also because Latin Americans shift to a model that works for small drugs. So if we want to produce ibuprofen in Latin America, we have the factory, we import the pharmaceutical ingredient from China, from India, and then we make the pills in Latin America. And that works. For drugs, for small drugs, it works. But for vaccines, a disaster, because we will always depend on the vaccine that is developed by someone else, okay? And then when a pandemic comes, you realize that you are in the middle of a disastrous situation, that you are not only unable to develop a new vaccine, but you are actually unable to introduce a technology that others already developed 10 years ago, and you have not been able to introduce it, not to develop, but to introduce. And then this is the situation that Latin America has now. That is important. That's why the political, socio-political, but political science cooperation with Europe as a unit, but also with the local European governments is very important, because we mostly say that you know that the United States is not going to do it. So we have to invest in Latin America, and we have to change all this paper that we showed to everybody about the vaccine production. We have to incorporate the word development. We have to invest in development and production, because otherwise we will only invest in making factories to fill the vessels for the vaccines in Latin America. And this is what Mexico is doing, what Argentina is doing, only Brazil, because we heard in the morning, so the Biomanguinhos Institution and the Butantan Institute, they are big institutions. They have the capacities. Nevertheless, they were unable to develop their own vaccines. They had to produce the vaccines developed by others. And that requires a type of investment that is a very specialized investment. So perhaps the vaccine is the most sophisticated biotechnology product that you can ever develop. It requires a mixture of chemistry, biology, immunology, clinical trials. We in Latin America, we are ideally unable to run a very serious clinical trial for a vaccine that we can develop ourselves. So we cannot do it. There are exceptions. I'm not going to mention, I am talking about general terms in Latin America. Forgive me those that are exceptions to these comments, okay? But it's not very the perspective for Latin America to develop our own vaccines and to be technologically independent regarding the rest of the world is not promising. It's not very optimistic, what I have to say. And I have to be honest, and I have to say. And that requires a lot of political wills, and this is what happens in Latin America. It's very common that our governments, regardless if they are to the left wing, to the right wing, they are always fighting to each other. In Europe, they also do it. But in Europe, for example, you have the European Medicine Agency. And the European Medicine Agency never consider who is in government in Germany or in France to approve a medicine. It doesn't matter who is in power in those countries. It's not political. The vision of how do we approve a medicine in Europe has no political vision. In Latin America, it has. And this is the worst that can happen to a vaccine. The worst that can happen is that you fail the clinical trial. The second worst that can happen is that you get political vision in the middle of the vaccines, and then you start to believe that the vaccine is good because it's coming from one country or from another, and then the vaccine is judged by the nationality of the country that produces the vaccine and not by the data that justify how good the vaccine is. And this is terrible, and that happens in Latin America. And now there is a very promising effort of several countries in Latin America. They are joining to create what could be like a Latin American regulatory agency. Because every country in Latin America, what we do, well, not Mexico, not Colombia, not Argentina, not Brazil, and not Cuba, but the rest of Latin America, what mostly we do is if the vaccine is approved by EMA or FDA, then we approve it ourselves. And this is clear, okay? If that regulatory, very serious and powerful regulatory agency approves the vaccine, we do it ourselves. But we need to have our own regulatory agency, Latin America regulatory agencies that are independent from the governments and for the political vision of the governments in that moment in power. They have to be independent, otherwise they will be politicized, and then this is a disaster, okay? So a vaccine has to be good because it's good and not because it's coming from a left or right-wing government, and that happens in Latin America, unfortunately, is happening. And that regulatory agencies have to be independent, they have to be able to set and to regulate and to set the path to carry out clinical trials. And for that, we need hospitals. We mentioned in the morning, we need a public health system that works well with powerful physicians, with biostatistics, with hospitals, which should be able, because it's not only the vaccine development process, but also we have to be able to carry out our own clinical evaluation to know that our vaccine is good, okay? And then when you consider that and you see that we are talking only about setting up factories to produce vaccines made by others, then we are in a very not optimistic path in Latin America, okay? But there are things to do. One thing to do is the GLACIER project that we have now, for example. It's a project funded by DAD here in Germany. It's a project that aims to build capacities and to train people and to form PhDs in the field of immunology, virology, social science, epidemiology, chemistry, biology, all of that, okay? So we need to train people. We know that this is not enough because the most brilliant minds in Latin America most of the time escape. That happens in Cuba a lot because people try to escape, so we are losing our best minds also. And then we are coming back again to the governments. The governments, they have to know that they need to keep those minds in the local countries to be able to be technologically independent, because it doesn't matter if you are using the cell phone made in Europe or in Japan or South Korea, but you have to be able to produce the medicine that is going to save your population. It doesn't matter if it is more expensive than purchasing that medicine in India. You need to have the technological capacity to do it, because when a pandemic comes, then it's a disaster for you. Okay, and this is what happened in Latin America, that many countries were living from the favors. And we were very lucky that China produced millions of vaccines more than they needed, and they were able to offer. But we were begging for others, send me vaccines, sell me vaccines. We were not only able to produce it, but we were not at any moment able to develop our own vaccines, with a few exceptions, of course. Okay, so and this is the discussion that I want to bring here, how the international cooperation has to focus. And this is what the GLACIER project is doing, but we have to do it better, and we have to expand, and we have to tell our politicians to include the word development in all the documents, not only manufacturing. And we listen in the morning, we only talk about manufacturing. European pharma companies, they don't want us to learn how to produce their vaccines because it's a business, but we have by our own to learn how to produce our vaccines, because we don't need it for hepatitis B, because probably it's easier to purchase a vaccine from India or from Europe for hepatitis. But when a pandemic comes, we have to be able to develop vaccine in a reasonable period of time, 1 year, 2 years, 3 years, when a vaccine takes 10 to 15 years to develop. And this is where we have to invest. We have to invest in training people, in retaining the people in our countries. We are not, and I am very critical with that, with the Cuban government also, because our best minds are also escaping. But in general, in Latin America, we have to train people in this very specialized field of research, which is very transdisciplinary, from biology to immunology to chemistry to medicine, and it's very, very, perhaps the most sophisticated biomedical product that you can do is a vaccine or a therapeutic also. Immunotherapy also is very specialized, but it's not a small drug that we know how to do it in Latin America, and we know how to, in these maquilas, we know how to make the pills. With the vaccines, it's different, and it has to be different, okay? Because now we are not able to produce it, we are not able to develop, we are not able to evaluate clinically the efficacy of our own vaccines or the other vaccine. We only rely on what someone else tells us to do. This is my opinion.
Thank you so much. Some very clear points about the training, needs for training, and how networks can facilitate that training and help with this. Bowie, please go ahead and give your introductory statement.
Yes, thank you. And thank you for these 3 points, which I think are very, very good. And I'll try to elaborate a bit on it. So I am a middle-aged white guy from the global north, you know, just to state it right away. So I'm quite spoiled, but I did spend 2 of my young years in Brazil, and my wife is from Peru, so I do understand a bit about Latin America, where I also work quite a bit. And I think the first thing here, before I come into networks building and collaboration across countries, which we are actually actively doing in Latin America, there are some basic questions. What is the purpose of the health system and health technology and building health? So is it to have the best health system in the world, or is it the healthiest population? It's not the same answer to those questions, right? And we tend to focus more on the system than on the health outcome. That's a mistake. That's a mistake from the global north that you in Latin America should not copy. And also when we go very, very deeply, so I'm from a future institute, so our job is really to question the reality of today. So what we always ask is, are we doing the right things and are we doing the things right? We are definitely not doing the right things. We might be doing them right. So the health system logic that we have built was established 100, 150 years ago, where everything was acute. I know that a pandemic is acute, but the rest of health, 75 to 85% is actually chronic disease that we need to deal with. That's non-acute. And the weaker you are on the chronic disease, the weaker you become to pandemics. So these two things are connected. So we also need to re-ask, and here is the opportunity for Latin America. You should not copy, you should leapfrog. There is an opportunity really to work. I mean, there are more than 500 million people using Spanish for health. 200 million using Portuguese, 2 languages, 700 million people. It's a huge opportunity to be the leader in working with the digital side of health and interfaces. So Augusto Galán, a former Colombian health minister that I had some conversations with, he used to say, if you don't know where you're going, every road is good. And this is what we are doing. And that is what is taking us to the wrong directions often. So when we work with something to push forward, it's very good to use the old words of Mark Twain, reality can be beaten with enough imagination. So what is it we really want with investment in health? I don't think that has been answered. We want more technology, we want more hospitals. So look at Germany, 30.5% of the budget goes to sick care directly. It has one of the lowest health outcomes in Europe. It's not a success. So more hospital is not necessarily a success. It's what you do with the money in that way. We have spent 30, 40 years in developing genomics and digital technologies, but we are applying them when people are 90% dead. It doesn't really help the people and it doesn't help the society. So this is really about reimagining how we could do things. So we started working in between the Nordic countries in 2019 to bridge in between the Nordic countries, especially on digital and genomics, but also understanding that the volume of knowledge that you need in order to provide better health in the future can't be done in small pockets. It needs bigger populations to do it. It needs to be cross-border. And we did the second phase now in last year and this year, where we really focus on how do we get from the what to the how. So one of our conclusions on the first one was that half of the budget should be more traditional hospital sick care, but half should be more preventative, so secondary prevention. So how do you deal timely with people who get the first chronic disease? 30% of the disease burden you have in societies is avoidable. We are not focusing on reducing that burden. So this is how we build sustainability, and this is how we begin to build planetary health in it. So in Latin America, a bit based on the work that we did in the Nordics, I was a co-initiator of Movimento Salud, Movement Health, which is a partnership with Microsoft, Siemens Healthineers, and Roche. So a private-public partnership. And it's also based on that 80% of the health challenges in any given countries are more or less the same, but we are still dealing with them as there are unique challenges. So how can we go across? We started in 9 countries at the same time and tried to approach it the same way in order really to build understanding how can we push this forward. Right now, we are pushing really hard in Mexico City, where we're helping the health administration to aggregate data so you can get real-time data-driven solutions. So you can take decisions on real-time data. And other parts here are as was also said before, the knowledge and the technology to, for instance, sequence and look at data or to produce different parts in Latin America, it's not there. No, it's right. And if we look at, except from Argentina and Uruguay, it's the double cost to do genome sequencing in any country in Latin America. So in Mexico, it's cheaper to fly to Houston and do sequencing than to do it in Mexico, even if the labor cost is 10 times lower. But this is not because of US or of Europe. This is because of the governmental policy in Latin America. So some of it, I mean, it's also to go back and say, where can you lead? Where can you go in as Latin America and really take and say, okay, what can we do that the rest of the world also need? To me, that's to build the best possible primary care, is to use data, early detection, because you have in Spanish, 500 million, in Portuguese, 200 million that you can scale with. This doesn't really, in Africa, this doesn't fly. In Europe, this doesn't fly. There is a huge opportunity to push this part here. And you should also have in mind that the fifth industrial revolution, which is meaning that the fourth on data, on new biology, all the genomics, and all of these things, on imaging and smart materials, is now beginning to be materialized in a smart way. Nobody really knows how to do it. So this is a clean playing field or clean slate to go onto. And going back to another thing that we have worked with for the last 10 years is whatever you do, go beyond party politics. If you make it possible for the politicians to use it in party politics, you failed. So how do you go beyond party politics in this? This is a challenge where the science, where the civil society actually needs to step up. To give the politician the blame, they don't do the work because we let them sit there alone. Democracy is not about what happens in parliament. It's about a fair society. So we need to get back into the game and take power. Nobody will give you power. So it's not about inviting politicians into the conversation. It's about getting into the game in that part. So the question we really ask in Latin America and everywhere else is, how would you do things differently if health was the most important societal pillar? It's not what you do when everything else goes wrong. It's what you start with. How do you apply health as a value generator? How do you apply health to reduce inequality? How do you apply health so you actually get planetary health and sustainability in society? How do you apply health so that actually becomes the most important pillar in the One Health approach to planetary parts? And this is where I don't think that Latin America has a choice. Because if you don't get this right, you're going to have much more unrest in the society because your young generation without decent work is quite big. So how are you going to do this in this way? So one of the examples more that I would like to mention is that we are working quite a lot with ORAS, which is the Andean Health Organization, so the health ministries of the Andean countries. And we worked with them over the last year on building a resolution across the 6 countries on the frames for the 6 countries on digital health. So they can develop their staff in the same way and begin to work together on the same standards. It's not a solution to all Latin America. It's not even a big solution for all of these countries, but it is a start. And where I would like to end this with is to say that we want the collaboration. My question is, why and for what? If that is not clear, it fails because the value in the collaboration is not there. And I will give you one example. When we started with the Nordic collaboration, it was basically me being very stubborn. I was totally convinced that it needed to be on data and on genomics. But what happens is that these technologies change so fast that the people you need to integrate, they change all the time. So we learned that this had to be about value. And then a clever guy or a woman in the crowd said, okay, we just apply the Nordic values because we're always so proud about the Nordic values. And then my stupid question was, what is that? Nobody had a clue. So we spent a month defining, okay, what are the values for this collaboration? And this is why this collaboration still exists, because we spent the time to say, what is it we want to do and why? It's not about the technology. Technology is a tool. So all of the things that are happening are very necessary. If we want them to thrive, we need to ask the question, what do we want to use it for? Why do we do it? And what are the values? The values are not changing. The technology is changing. Thank you.
Yeah, thank you very much for that. Very like zooming out a little bit and looking a bit more like where do we want to go? This is what do we need this cooperation for, and what do we actually want to achieve with it? Maybe Elisabeth, you could elaborate a little bit on how this happened in your in the project you've described in the observatory. So how were these aims set and defined?
once that the Secretaría General Iberoamericana received the mandate, they started to contact different groups and networks in Latin America, Spain, and Portugal in order to try to define what could, knowing the vision that they had, the mandate by the chief of states, trying to identify in what was the purpose of this mechanism that it was proposed and defining the objectives through a process of networking with the remains, with the members that they represent the ministries of health in those countries, and trying to through different meetings set up with the objectives and later working in the work plan. But still, yeah, it's still a continuous process and trying to engage. There is a huge problem, I think, in the turnover of the people that are representing the ministries of health in this network. So because every time that you try to contact someone, that person has changed, or if that person hasn't changed, the person above the political mandate has changed, so they cannot make the decision until they have the approval from their politicians. So it's really a process that is pushing and trying to push the work and creating and going after the people in order to produce a work plan. But it's been a bit difficult, to be honest.
Thank you very much. Yeah, I think we hear a lot of political will issues and then also a lot of coordination and communication issues. I wonder, Daniel, I mean, this vaccine development and manufacturing and production capacity thing is happening with Africa. There's a lot of talk in the EU and a lot of initiatives also in the EU to get this done in Africa. Are you aware of activities in Latin America? And what do you think, what would be needed in terms of EU and Latin American collaboration?
Well, as I said in the papers, there are a lot of ideas which have been written to how to increase production capacities. But most of them, I could say that 90% of them, when they mention about production, they mention about refilling the vessels and not actually producing new vaccines or developing new vaccines. In Africa, well, it's South Africa mostly, and then many of the countries in the south, which they have, I could say, not all of them, but they have some capacity. And in Latin America, of course, we have Brazil, and we have some ventures. Well, we have the Cuban venture, which is small in size, it's independent, but Cuba has no money, so it has a low impact on the Latin American region. But I think that what Latin America has to do is that several governments, they have to join together and to make like a supranational network of vaccine development and production. Because not all the countries, they need to reproduce the same capacities all the time. So you can have some capacities in Brazil, some in Argentina, some in Uruguay, some in Colombia, some in Mexico, and some in Cuba. And there, once you have a supranational network, but for that, of course, you have to communicate. The countries have to communicate. And then sometimes happens that there is a change in a government, and then the countries, they don't want to talk to each other anymore. We as scientists, we cannot deal with that, but we have to try to create a networking that rules how to develop, to produce, and to regulate the vaccine introduction in Latin America, and to make it for the entire continent, okay? And the Pan American Health Organization has to be more aggressive on that, I think, how to say. We have the Gavi Alliance, which is making a lot, and Gavi has a major role on introducing vaccines in Africa, in the South Asia, but also in Latin America. But I believe, for example, that Brazil, and now they're here, I believe that Biomanguinhos could be a Serum Institute of Vaccine. It has the power, it has the capacity, or it should have the capacity to become such a huge vaccine producer, not only for Brazil, for the entire region of Latin America, because they have the capacity, but they cannot do it alone. They have to do it perhaps using factories in Argentina, perhaps using factories in Mexico, perhaps using knowledge from Cuba, from different areas. And we have to communicate better and to work together better to be able to create such a supranational vaccine development platform. When I'm talking about vaccines, I'm talking also about biologicals, therapeutics, immunotherapy, everything related to health. Okay, I am more in the field of vaccine, but it's the same for cancer, it's the same for diagnostics, it's the same for most of these highly specialized biotech products, which require so much knowledge that you always depend from the north, and you develop very few things in your own country beside of just producing. But I believe it's supranational, so we have to coordinate better the regulatory agencies. As I said, we have to coordinate better how do we have our own rules to approve our own medicines, okay, and not be depending on EMA, on FDA anymore. We can follow the rules of them because they are leading agency, but you don't have to follow, because sometimes we want to approve something for ourselves, for a drug. We have Chagas in Latin America. This is not, doesn't matter for the rest of the world. Malaria mostly does not matter for the developing country. They have actions through Gavi or something like that. But these are medicines and vaccines for South. But also, we are always talking about pandemics, but we have meningitis. We have meningitis outbreaks. We have pneumococcus, which kills millions of children in Latin America and Africa every year. And still the pneumococcus and the meningitis vaccines are not fully available. And we have to do better to improve our capacity for developing our own vaccines, to regulate the introduction, to coordinate more the action. What do I do? What do you do? How can we set up transnational institutions to advance this field? Is what I believe. That is my personal experience. Okay.
Thank you. Thank you very much. Felix has a comment. Well, we do.
Very good point. Thank you, Vladimir. Daniel, thank you for, thank you for saying all this. And I agree 100%. But if you link this to what do we want, how do we achieve something? It's very clear, I think, that we need a Latin American capacity for vaccine development for many different things. Your point on not just focus on emerging viruses is well taken. But Cuba is politically isolated. Cuba, many countries they over-obey the restrictions from the United States, in that they simply cannot trade with you. Everybody else in Latin America, and I take out Biomanguinhos, is the one example. Of course, I'm ignorant, so maybe I don't know. Biomanguinhos is still beyond you guys. So we have Finlay in Cuba and a few other institutions who, because you were obliged to, kept the knowledge, the know-how to produce vaccines. They do. Few others did. Colombians have lost it, I think, in the last 20, 30 years. They had it, but it was cheaper to buy it on the market. But they were surprised when the market collapsed and they suddenly didn't get any vaccines. Big surprise. Okay, fair enough. So the market was not working as soon as the principle of access and were not working, and supply chains. So how do we do that now? So we have Brazil and we have Cuba. So how does this lead to a regional vaccine producing solution? Really enlighten me. What about the EU call that came out a year ago? It was not a call. I remember Ursula von der Leyen tweeting. I don't know, I'm not on Twitter. Something went out there which said we have 1 billion euros for vaccine production in Latin America with a focus on Cuba and Mexico. I remember you and me shared it and we got all excited. Hey, $1 billion or euros, actually euros, of course. So where is that money? What is happening? Is there any such thing as an initiative of, say, a strategic alliance of know-how, of Latin American know-how on vaccine production?
Yeah, only observations. Yeah, you're totally right. Thanks for the reference. But in fact, who is leading this process in Latin America is PAHO, is Pan-American Health Organization. And so we were requested to be a hub for mRNA vaccines, exactly like that. That's the idea, exactly. So Brazil can be one side, but of course, in South America, we have other capacities, but one step after another. And so I think it's starting by that, and under the WHO and PAHO coordination, because that's the way, the route, it really must be organized. And Daniel approached something that's very important, and it's a bottleneck. That's regulatory issues. Because what's valid for us is not valid for Argentina and couldn't be to Cuba. Yes, but I mean, when you think regionally on development and production, this is the next step that we must agree in between. And only the last observation, we deal with Cuba in Brazil, and we have somehow a historical even diplomatic relationship, especially in this government. And so Cuba has also a very strong background. For example, I analyzed in Brazil kids from Cuba in the HIV time. So I think we must have a better organization, but PAHO somehow is coordinating this work and not only looking at production, but R&D. And we have different actors inside WHO. This is a major strategy for different countries. And of course, each one of us has his own power that we must just chew these relationships and have a clear plan. That's the fact. And anyway, it's not possible anymore. And I go beyond Latin America. For example, some the pharmaceutical starting material, I don't know in English how to say that. You can't have only China and India producing that, because it's not a question of value, but it's a question of if there's any kind of break there, all the world stops. That's very simple. So we must have regional efforts. So I mean, okay, you have a very strong industry, of course, in the global north, but we must do in the south and think into different points. We can't concentrate production of anything in only one or two sides. It's impossible.
Yeah, I just want to pinpoint the production of vaccines. Colombia closed in the middle of the 80s. The vaccine production now is reopening again, production, but only filling in Antioquia is a private company now, but it's coming something that probably is interesting for the question that Felix is doing, and probably will open a possibility to make kind of regional collaboration in production of vaccines or increase capacity. The government of Bogota will invest for opening or create a new vaccine fabric or new vaccine manufacturing. The problem is they made the deal with the Chinese government. Means they will do the Chinese vaccines of first generation with the Sinovac, but because it's a government dealing of the Bogota capital, can be possible that it's open to probably develop probably collaboration with Brazil. I don't know if it will be possible with Cuba, maybe with this government that is from the left, that is open any kind of possibility. But I think it's a good opportunity. It's from the government of Bogota. The mayor of Bogota is quite open to collaboration. He has an open mind, and it's just one possibility that I put on the table. No, it's possible to have any kind of approximation with them. I don't know how is it dealing with the Chinese, if it's exclusively or not, but it's a possibility. They will open in 2 years the facility, the new facility.
If you ask me, I believe that Argentina, Colombia, and Mexico, they have to do better than they are doing. It's my personal opinion, because they have the power to do it. They have the economic power to do it. Mexico has to be a major player in this. Colombia can be, and Argentina can be. We know what is happening, and we know that Cuba is isolated because of political reasons. So Cuba cannot be an example, because also in Cuba, these companies are state-owned companies, and it's very difficult because the governments, what they have to do, we have to be honest. We, from the academic, so typically this highly specialized knowledge is created in the academic and then is transferred to the industry. So you have to support the local industries to do that. You have to subsidize, because it will be always cheaper to buy in China and India. It's very difficult to buy a polio vaccines cheaper that they are selling through the PAHO and the Gavi. But if you don't develop the technology in 10 years, in 20 years, you will not be able never to produce your own vaccines. And this is what's happening, that the governments prefer to buy the cheap vaccines produced in other countries that create our own technology. And the only solution for that is to consider pandemic preparedness or health in general in the same strategic level as energy, food production, and defense. Is the only way. When we treated health like one of the priorities, like these things, because every country has to be energetically independent and independent in health and, of course, in defense. But we don't treat the preparedness for pandemics in the same level of priority, because it's not always about money. Those countries, they have the money. It's more about political will. I think about that, of course. I'm not criticizing. Well, I am, but I can do it here, but I also do it in my own country because it's also happening in Cuba. Probably in 20 years, Cuba will not be able to develop the vaccine that we did now because we are returning what was invested 20 years ago, but now the economic situation is different. But I think Latin America can do it better, have to coordinate better, and you have to depoliticize a little bit the health system. It cannot depend so much if two governments are left-wing governments and now we like each other. It has to be independent from that. You have to realize that regardless of the capacity of the government that you have in Argentina or in Cuba now, there are capacities there that you can coordinate with and you can incorporate into the networking. This is the only solution for Latin America, I think.
Thank you. So I agree that probably the main point is to get health to be both safety and security, but you need to articulate it. And this is what it means to put health in the center. So how do you articulate that one? So another point, which, because this is also about the European and Latin American collaboration. So some 5 or 6 years ago, I helped 3 of the European research infrastructures. So BBRMRI on biobanking, ECRIN on transporter trials, and IATRIS on translational medicine to merge into AMRI. And we also had quite some discussion on how do we connect this to Latin America, and we tried to push in different ways. And the reality is that how can we call the counterpart in Latin America is not very established. So how do you so one thing is what we want, but the other thing is then how do we do it? And I think that is really where we need to take the discussion. I think it's too easy just to say we want this. The hard question is how and where do we start and how do we prioritize? I couldn't agree more with the vaccine and vaccine independence, but it also needs to have a starting point. So what is the first target to go after? And the reason I also mentioned this is that with our experience of working is that Brazil is okay structured on science, could be better, could take more responsibility. The other countries are not. So that's also an internal part to push. And again, I don't buy the excuse that it's not prioritized politically. It needs to be pushed to be prioritized politically. I'm very sorry, I will tell you a secret. Politicians, they respond to what the people ask for. It's a big secret, right? So I do think that this is a way that that really needs to be pushed. And if you look at the European infrastructures, there are 13 of them which are relevant for health and development in different kinds of health science. So to begin to work with them is one step. I will also tell you, working with European money is not easy. It's extremely complicated, and you would really learn what bureaucracy means, right? But you cannot do it if you're not setting a clear target. What is it we want? Where is we want to start?
Thank you very much.
Thank you, Bogi. Very interesting comment. I would like to take this. I mean, you are calling for concrete, like precise. So what do we want? I have a response for that did not fare well to my knowledge, but I'm again I'm not in the decision-making game. So the Global Gateway Initiative was mentioned straight from the beginning by in the opening words of our guest from the European External Agency. I'm not sure if she's still online. I hope she is. And if you are, please feel free to comment on what I will say. There was a strong initiative from the German Foreign Ministry of External Affairs to contribute to a European Latin American Center, Translational Center for Infectious Diseases. And I wrote a 2-pager back, like 3 years back, on how this could look. Then I even tried to estimate costs, which is not something a virologist normally does, because how do I know, right? So, yeah, in the end, the German ministry took it further, and I gave a short 45-second speech to a meeting of the foreign ministers of all of European countries and all of Latin American countries that took place here in Berlin, maybe 2-3 years ago, Julieta, you may remember. And in my 45 seconds of fame, I said stuff like, it's really important to have something physical, an office even, a starting point, somebody you could talk to, somebody that you could discuss with. And this was put then into, I don't know where it went. It went from the German ministry to GIZ, which is the German agency developing development aid. I'm not sure where it went. Maybe hopefully it's still ongoing. The point is, you needed European money because it's not something that one government could take care of. It's not in the range of 30 million. It's probably much more expensive. And the whole argument was that the Global Gateway Initiative could be something that could compete with the geopolitical strategy of China, the new Silk Road, so that we could make understandable to politicians, because let's say they don't buy health should be a primary pillar, but they should be protected from Chinese geopolitical games. Most politicians, I would say, should get that argument because it's very obvious, right? And you see it all day in the news when EU now declared 100% tax increase on Chinese electromobile cars. So if a European Latin American health infrastructure should be part of the global gateway strategy to make a stand, geopolitically speaking. Now I'm really talking about power games and not about humanitarian things, everybody for him or herself. Fair enough. Let's take it from this perspective. I have seen nothing more happening, and hopefully it will still come, but that could be something. So that means two things. One is we acknowledge that health and European Latin American health cooperation is actually a political move, a geopolitical move also, beyond being prepared and beyond getting pathogen data or specimens or they get vaccine strategy. It's a geopolitical game, because why should they buy our vaccines if China, I mean, I get it. It's cheaper, it's a strategic value, and it's not the first time, Vladimiro, that I see China investing heavily. I went in the pandemic to Venezuela, to the National Health Institute in Caracas, and the whole line of industry, and it was not badly equipped, the institute for diagnostics, so my field of play. All of it is Chinese, everything, every robot, every pipette tip. And you don't have to be it's not hard to say that this comes at a price, which is access to primary gold, petrol, I don't know. I mean, I don't know the contracts, right? But let's assume that China is not doing that out of love to the Venezuelan brothers and sisters. So this should be a point of action that should be communicatable. We are part of a geopolitical power game, and fair enough. And what we are asking for is, I think, a relatively modest investment, which is a joint health infrastructure in Latin America. We can also permit that Latin Americans will eventually do it without the Europeans. The Latin American CDC, like CARPA, like the Caribbean. They will do it without us. Of course they will. Brazil will have a strong play in it. Why should they listen to Europeans? Why? Just because we are so nice? I mean, we have to be prepared to invest. And I bet it's at the end of the day, a small investment compared to what the price we are, or to what we are investing in lithium, access to lithium and actually rare minerals. But I mean, this is not communicated. I have not seen it that openly, or maybe I'm wrong. I don't know. Please comment. And I'm really a shout out for our expert from the European agency, if you're still online.
Are you? I don't think so. No. Okay, so.
No, I just wanted to say that I'm going to speak about the Global Gateway in the next panel. So maybe we are going to understand. I don't know where it ended, your proposal. never in my desk, and I'm dealing with health in Latin America and the Caribbean and the European Commission side. So there is, I hear in the morning in the panel, a lot of network connections. We need to speak in a multi-actor scene. And I think this is lacking from Europe. This is one of the gaps that we have. This is a demonstration of, I am looking for projects to put in a pipeline to link with the financiers and investors. And you are looking for the financiers and investors, you see. So this is a little bit the objective of the Global Gateway. It's difficult to put it in place. I leave it here because I will explain afterwards.
Interesting, that would be a great, yeah.
You need to bring it to hand. The basis that
Yes, now I know.
So thank you. I had a comment and a question to the panel. The comment, a little bit building on what was just said, is that earlier I said that we are facing 21st century challenges with 20th century frameworks, mindsets, okay? And that has a lot to do. I heard our Cuban colleague talking about independence. I would rather call it autonomy because we are interdependent, and that's something that we need to understand. And from the top to the bottom, unfortunately, that's not what's happening. And so I won't get into political discussions, but definitely this is about interdependence. And it's about finding the ways to cooperate, to collaborate. This is very nice said like this, then we know the real life, how that is. But I think definitely that, and also this is it's the case for Latin America, we need to find the institutional ways, and I'm stressing the institutional because that's not something political. That's precisely, of course, it's politically driven, but that's something that is there to stay beyond politics. And there's a famous book, Why Governments Fail. Governments fail because they don't have the adequate institutions. And institutions, increasingly for 21st century challenges, need to go beyond the country and the sovereignty level. So here goes my question. If you had to think about Latin American-based institutions favoring cooperation, favoring a little bit equitable and effective response to shared challenges, what would you put in the picture? You mentioned a regulatory agency. That sounds very reasonable, and in fact, it's happening in other places. What else, if anything, would you place as a somehow a relevant tool to keep things going beyond something that is important? But I think we are beyond the funders and project developers, and I come from academia, so I know the dynamics, but whether we like it or not, it has to go beyond that. Oh, thank you.
So one thing is the process and the other thing is the content, right? And I fully agree with you that we are using old ways of thinking. I mean, we behave as the world was still on paper. So the Andean Health Organization, even if it's not very famous and very known, actually it's more than 50 years old. And some of the things, and it has a very limited budget, but some of the things in the ways of working might be an inspiration. So the main meeting is the ministerial meeting, which happens once or twice a year. And that's with the minister, and it's highly political. Then you have other expert meetings with what you would call politically appointed people. So this is also political. But then you have an organized expert committee with what you call those who move the cradle. So those who are not moved all the time. And this is very deliberate. So you get institutional memory into it. And then you also go down to the educational and the practice system and give them different kinds of knowledge continuously and pushing in that way. So I think that is a simple way to explain what is necessary to do in that. I don't think the process necessarily is rocket science, but the action to do it is actually very hard to do these things. And when it comes to content, Latin America is not different from any other countries. What is going to happen now is that you are not just gonna have to do regulatory on drugs. It's drugs combined with data. It's drug combined with apps. It's biological expressions combined with drugs. It's pharmacogenomics. It's going to be so complex, I mean, and this is one of the reasons we have worked so much in the Nordics, because even how well you are developed, with 5 million people, there's no way you can deal with this. So this is also what you come back to beyond sovereignty, which is really, really important. But you cannot start this process if you don't know what you want. What is it really you want to use these things for?
Any other comments on that question?
Yeah, I would say something. From the conversations of the working group in the observatory, one thing that they have pointed is the lack of information sharing processes, that sometimes neighboring countries that they have a border between them, they have to access data of outbreaks through PAHO because they don't have any communication, even when the outbreak is just on the corner of their country. So one thing that I think should be trying to work is on a process of getting real-time data that is accessible, public by all the, and I know that all the difficulties with the pandemic accord, what is happening on the sharing of information, but I believe that this is an area that it should be invested in the region in order that all the countries have access to the same kind of information that is able to inform their policies and their plans and prepare for an outbreak that is happening in a neighboring country that can go into their country anytime.
Should there be an Latin American CDC, for example?
Yeah.
Can I ask you that? Yeah. Sorry, I repeat the question. Should there be, and sorry because I just sneaked in, but should there be a Latin American or regional CDC like it's in other places? And the last version is in Africa recently. So
yeah, I think so. I think this is the path. I believe what Europe, because let's come back to the European Latin American cooperation, because we can keep criticizing our Latin American countries here endless. And I think what Europe could do perhaps better in Latin America, besides of training and capacity buildings and formation of people in this specialized area related to the One Health concept, is to try to invite. I know it's difficult to try to reproduce or to try to implement the type of institution that you have here in Europe and Latin America. And these institutions, they work regardless who is in power in each country at that moment. So there is a type of independence or European vision of this is the best for the continent, although it's not the vision of the local government nowadays in the power in a specific European country. And in this conversation that CELAC, for example, have with the European Union, the health topic has to be put at the same priority that deforestation of the Amazonia and the climate change and all other topics that are of interest of the European Union, because sometimes, so we look at Brazil only when they start to deforestate the jungle, and we have to look at them always. And then we have to put the health at the same level of priority of that. And the concept, I repeat, and I insist on that, it has to be, because I have read many of the documents, and in most of the cases, what you want is to make factories for filling European vaccines. And this is not the topic. The topic is formation of human resources, cooperation, and try to reproduce, but this is difficult because the Latin American governments cannot feel that you are trying to impose the type of institution that you have in Europe here, but to try to invite the Latin American countries to create transnational institutions that are not so depending on the color of the local government at the moment, and they work together in cooperation, detection, surveillance, preparedness, everything related to the One Health concept. And that has to be at the same level of the same priority issues that Europe discussed with Latin America in these 2 years conference meetings that you have. I don't know if they are yearly or every 2 years. I think the One Health has to be put at the same, because Latin America has the capacity, and we have to say it has better than Africa to be a powerhouse of biotech products. It has it. If we coordinate better, we have the capacity. And we have also the European mentality. So we are closer to Europe than to China in mentality, in our type of behavior, okay? Because we we are closer, and then we could implement the type of European institutions that are more transnational and do not depend so much on the local governments. I think.
Yeah.
Professor was raising the hand.
And I have the microphone, so. Well, congratulations, because you have highlighted very specific and very key points, and that is the first thing. But we shouldn't forget about the community. How do we reach them? And during the pandemic, we work very closely with the técnicos de atención primaria de salud, or the TAPs. They belong to the community. They have been trained, very elementary training, but they are part of it. They convince the people about what to do and how to do it and when to do it. And this is crucial to any initiative. We can have the best vaccines. We got Pfizer. What can be better than Pfizer? Nothing. They created Viagra, right?
They didn't create the vaccine.
No. I'm saying, I'm talking about Viagra. And we got that. And commercially, I think it is very important to also, the biotechnical development is essential for the country, and all the regulatory measures and regulatory in the inner institution. But don't forget, let's not forget about the people. How do we interact? And we have, I mean, a coverage of vaccination coverage, for example, better than many places in the United States or in Europe. I'm talking about the less than 5-year-old vaccination process with BCG, DPT, and all of that. And we do it very well. And if the mom doesn't show up to the clinic, then we have the expertise and the planification and the trust to go into their households and vaccinate them. Can we use something like that? So the incorporation of our community and incorporation of the primary health is absolutely essential.
Thank you very much. I'm afraid we need to close this off. You've made my job really easy as a moderator with the lively discussion. Thank you very much for that. Please do take your question, address our lovely panelists in the coffee break. I would just like to invite you to do one word answers, or maybe 2 words. What is the essential ingredient of a well-working network in your point of view? Just 1 word. Who's ready? Yeah, you're ready.
Trust.
No,
It was 1 word, right? You told me. So I think it's trust is there.
no words.
Direction.
Priorities.
Science behind.
Nobody said lie.